Good morning, everyone. Let's call court to order. Is there a motion to accept this report for recording purposes?
So moved. Second.
Have a motion and second. Any other discussion? No discussion. All in favor say aye.
Aye.
Opposed? Pass.
Recording in progress.
All right, good morning, everyone. Let's call court to order. Today is June 18th, 2024. It's 9 a.m. Proof of posting, please.
The agenda was posted on June 14th, 2024 at 10:35 a.m.
Thank you. All right, at this time, let's briefly pause for a moment of silence, and we'll stand, and then we'll do the pledge to the flags.
Please join me in the pledge. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Now the Texas pledge.
Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
All right, thank you. All right, at this time, if there's any members of the public who want to speak to the court on business matters, please do so at this time. I think there was someone that signed up. All right, good morning. If you'll state your name and your address where you live, you can sit down. And keep your remarks 3 minutes or less.
Yeah, that'll be very quick. Yes, good morning, everybody. My name's Ian Camacho. My address is 4220 Grimm Avenue, Waco, Texas, 76710. I am the Republican Party Precinct Chair-elect for voting precinct number 30. I've been a Waco resident for over 2 years. I'm also the owner of 2 rescue dogs. I'm part of a grassroots group that just formed in response to the lost and stray dogs here in Waco. We were featured in a segment this weekend on KWTX, and a link was in my comment summary that I submitted this morning. I'm aware that my comment is unrelated to today's agenda, aside from the brief discussion of the animal birth control clinic expenses for May. However, I wanted to ask, how can we help you? We know there's a cost for the cities and counties to send animals to the Waco Animal Control. We know it costs Waco money to feed and shelter these animals and pay the staff and the utilities and such. We know there's a cost for the animal birth control to spay and neuter animals from all over the county, and they're overburdened. And we know you're looking to reduce spending and make better decisions and help the public. So when it comes time to discuss that item, we just ask, would you be so kind to discuss your thoughts on animal welfare in McLennan County? Would you please discuss what your constituents are commenting or complaining about when it comes to that item, animal welfare? And most importantly, would you be able to share information so that we can assist you as best as we can to help reduce your burden? We only are seeing Waco's perspective because we're from Waco, not McLennan counties, which we'd like to get the whole county involved. Maybe it's extra cost for the county and the cities outside of Waco, which could maybe set up their own ABC clinics. Maybe having local holding centers for lost and stray animals that will reunite animals with their owners more effectively and not have to pass that cost on to the local cities. Maybe we can reduce the cost and strain on Waco's maxed out resources, which will save more animals as well. So I have actually a partner over here, and we are planning on attending the city council meeting tonight, but we would also like to go to city council meetings for all of McLennan County cities and towns, not just Waco's, and hopefully maybe they can sign on to perhaps look into sharing the cost of building another animal birth control clinic or holding facility in each county precinct instead of sending the animal to the Waco shelter or rounding up animals, because that's a cost passed on to each local municipality. But we can only do that if you share what you need and what you want with animal welfare reform. So I'm just asking that you share your data and your thoughts so that we can help you come up with a sensible solution that saves taxpayer dollars and animal lives. That's all. Thank you so much for your time this
Thank
morning.
you. Thank you, sir. Anyone else? All right, thank you very much.
You're welcome.
It's not, the subject is not on the agenda, so we really can't go into depth. But I will say this, that the court has been supporting animal birth control and thinks it's a worthwhile endeavor. And so going forward, we're continuing to keep our eyes and ears open on ways that we can improve those situations that's happening out there in the community. Thank you. Appreciate y'all coming too. All right, today we do not have any proclamations or resolutions. So we have several in-person presentations before I go to the consent agenda piece of it. Well, first of all, let me go to the consent agenda just so there's items that are on there that do not need to be pulled and discussed can go ahead and they can start approving on those. But in the recommended pulls for consent agenda is item E3A and E3B. Is there any other recommended pulls? If there's no other pulls, is there a motion to approve the consent agenda with the exception of those pulls previously mentioned?
So moved. Second.
Motion second, any other discussion? No other discussion, all in favor say aye. Aye. Opposed? Pass. Okay, going to presentations. First of all, I get to pick the order, and so I always like to get recognition. So we're gonna take recognition first, but we'd like to talk about Christmas, even though it's summertime, right? And so Christmas will be the second thing we talk about. And so first I'd like to there's some TAC representatives here if y'all want to come forward. I think y'all have a presentation to make to us. And so if you'll just line up in front of these microphones and you can do your discussion. And if you would introduce everyone or y'all introduce yourselves.
Absolutely.
Good morning, Judge, members of the court. My name's Joe Shevchik. I'm a risk control consultant for Texas Association of Counties. I'm your risk control consultant. I replaced Isaac Garcia about 6 months ago. I was in the Southeast for about 6.5 years. I've been with TAC for coming up on 7 years. So I'm excited to work with you. I provide all kinds of safety training. I review county losses with workers' comp, auto, property, general liability, things like that. I also provide training and assistance, help with sample policies, to help improve the safety for the county and their employees, making sure everybody makes it home safe at night, to keep the pool costs low, but most importantly, to make sure everybody is safe. I also help with things like property inspections. If you're buying a new property or you have an old vacant abandoned property, I can look at those properties, make recommendations for the safety and welfare of those properties, work with your building inspections folks and maintenance folks and provide recommendations and trainings and other resources like certain tracking softwares that some counties are using and things like that. Just to facilitate conversations between the counties and myself to help make you guys more efficient and cost effective.
Good morning, Court. My name is Haley Beaver. I am the HR consultant for the Northeast region for the Texas Association of Counties. Prior to joining TAC, which I've been here for about 2 years, prior to joining TAC, I was an HR director in a East Texas county, and then I started my career in the AT&T world, in the corporate office there. I do a lot of the things that Joe does as well, except for on the HR side, so I can provide policy reviews, HR risk assessments in our HR offices, HR trainings, and then of course we have our monthly HR webinars, which I would love to invite all of you to. There's one coming up on June 25th of the latest HR trends and changes. Huge FLSA changes were just made, and the rules and regulations were just passed out, so we are going to be going over those. So.
Good morning, I'm Lisa McKeag. I'm the risk management consultant at Texas Association of Counties, and I work with the counties on their coverages on the property and casualty side. I would like to invite you, we are having a regional in Bell County. I've got the cards on that, the information. We're having them throughout the state, our fall regionals. We invite you to join us at those if you would like to. Thank you for having us this morning.
Thank you.
I would like to present McLennan County, with our commemorative 50th anniversary being in the TAC Risk Management Workers' Compensation Pool. You guys are one of 49 members, one of founding 49 members. So we are very blessed to have you part of our group and are part of our pool. And we would love to thank you for your continued support.
Yes.
So
Thank you for being a founding member.
if you guys have a chance after court, we'd love to get a picture with you.
Well, if it's okay, we'll do it right now. And if y'all
Absolutely.
will come back here, and I'd like to ask HR Director Honor to come forward and join us for that. And Ken's already here, so we'll have that. And we'll have, this is so important, we have our county engineer running the photography.
So important.
Okay, thank
And
you.
let me see, let's maybe move this chair. And y'all come in here.
No, no, no.
And, yeah.
I'm wearing bills today, are you good?
And then also I want to mention, first of all, we really appreciate getting this, but also this is a new standard for a plaque. If you can't bring a plaque, it's at least as nice as this one.
It's handmade, hand carved.
It's handmade and heavy.
All right, are you all ready?
Yeah.
1, 2, 3, all right.
1, 2, 3.
Okay.
One more. Let's see how this, back up this. I chose a portrait. I didn't realize it.
Don't be selling these on social media.
I guess I shouldn't have chose portrait.
That's a nice case you got there.
Thank you.
Well, thank you so much. We appreciate it.
Thank you.
And we really enjoy our relationship we have
Yes, sir.
with TAC, and we thank each of y'all for doing it.
Thank you so much. Good to see you.
Good to see you again.
Appreciate you
Yeah,
squeezing
take
us
care.
in. Thank you, sir. Take care, Lisa. See you.
Bye.
You're welcome.
Okay, next, we're gonna talk about Christmas, I think, so, oh, yeah. So, is there a motion to, approve the acceptance of this, award?
So moved. Second.
A motion second, any discussion? No discussion, all in favor say aye.
Aye.
Opposed? Pass. Thank you. All right, at this time, we'd like to ask the,
What item was that?
that was item M8.
M8.
Thank you.
Okay, I'd like to go to item M7. This is a presentation from a group, Lions, as well as some of our representatives from the DA's office, a discussion and/or action regarding Christmas tree display on the courthouse grounds for victim services. So whoever wants to come forward and talk about that, please do so, and introduce whoever you'd like and that's with you.
Hello, crew.
Thank you.
I'm Cindy Praisel, and I'm a member of Waco Women's Lions Club, or one of several clubs in town. And we do quite a few community service projects, and our emphasis is on children and women. And one of the things that we recently learned about is the need for extra care in the victim services. And so one of the fundraisers we would like to ask to do is to, let's see if I can explain this. We would make wooden Christmas trees that stand about 4 foot tall. And we would ask businesses and individuals to sponsor a Christmas tree and display them with their logo or their name on the courthouse yard, and hopefully lit up during the month of December. Our goal is to grow this to we probably start off with maybe 20 Christmas trees, and each year, we would use those same Christmas trees and maybe add more sponsors, and the donations would go to victim services and use however they see fit. I think I've said everything I need to say.
Where would the donations come from? People viewing the Christmas trees voluntarily?
We would seek the donations from businesses and individuals. The Waco Women's Lions Club would seek those out. And hopefully it would become so popular that it would be the thing to do, because it's, for the children of the victim services. So,
People aren't buying the trees stay.
yeah, and our goal is to sponsor them for $50 each. We would have a logo made out of, I'm not sure exactly what material, but they would be applied to the tree. At the end of the season, we would take those logos off and store the Christmas trees in our storage, and then reuse that Christmas tree with a different logo.
Just a family or a business, anybody could sponsor a tree.
Anybody can sponsor a
And
tree.
they don't grow and they require no maintenance.
Maybe painting every other
And
year or so.
They'd be displayed on the courthouse lawn during the Christmas.
And the reason why we got that idea is because another Lions Club in another town does the same thing, and so we thought, well, we'll copy that if we could.
Well,
All the time.
yeah.
I'm sorry?
We copy all the time.
Yeah.
No problem.
There you go.
My question,
the first one.
Great.
there you go. So, and 100% of the money goes towards the purpose, is that right?
Yeah. What we would keep is if we had to pay for any supplies. And our goal is to ask builders around to supply the wood. And I have a connection with Sherwin-Williams, and they would probably donate the paint. It wouldn't take that much paint to do.
Okay, so if the court approves this, we need to get with building maintenance, talk about exactly where they would go and where they could be prominently seen, yet be functional with everything else that we do.
We've really stepped up our game around here for, as far as Christmas decorations go.
Yeah.
So I definitely want to coordinate with TJ and his crew
Yeah.
about where to place them.
Yeah.
So,
And any advice you guys could give us, we're welcome. We're open for any ideas, suggestions. But our goal is to raise funds for the victim services.
My first advice would be get that guy's name over there.
Yeah, don't worry.
Separate him from his money as quick as you can.
We already have a few potential sponsors as the word's getting out on what we want to do. And so a few of us in Waco Women's Lions Clubs are business owners, and so we're kind of starting out there to get it going.
Okay.
and this would go to our victim services fund, or where?
We have a few different programs. Our victim rooms
That's what I
need
thought.
updating
Okay.
through the DA's office, and
Okay.
then there's other victim services within the county that need funding.
We've already done a couple of things for them, like supplied stuffed animals, and I think we might have brought some snacks and that kind of thing, but we'd like to step up our game and do a little bit more.
Okay.
Since you've got a commitment already, I'd get $100 a tree.
We might do that in the second year. No. But we know that we have only a little bit of time to get those trees made. So, ourselves and our husbands and whoever is going to help us do that. So we need to get going on that to not be stressed at the end, to make sure we have at least 20 made. That's our goal for this year.
Okay. Any other questions or comments by the court? If not, what's the
Great
pleasure?
idea. Make a motion to approve.
Second.
Have motion second, and that would be subject to TJ,
Correct.
subject to approving it, and then with follow-up of the location and that kind of thing. Okay. All right, we have a motion and a second. Any other discussion?
TJ, okay.
No other discussion. All in favor say aye. Aye. Oppose? Pass.
Thank you. Yes.
Super idea.
Thank you.
Merry Christmas.
Yeah.
Here before you know it.
July 1st, Hallmark Channel, Christmas in July.
Okay, we got all the fun stuff out of the way. Let's talk about clean air right now. Let's go to item M6. Ask Clark Hood to come up. He represents Active Pure, and he's going to update on Active Pure Enterprise LLC regarding air and surface maintenance program that we've been engaged with them. And so this is a follow-up. Kind of let us know, your professional opinion about how we're getting along, the value of the product and the service and those kind of things.
Sure, absolutely, and I'll also want to
Excuse me,
introduce.
and this is item M6 on the agenda.
Thanks, Judge Felton, thank you, Commissioners. We're excited to be here. We've had a 2.5 year ongoing partnership, and our goal today was to just update you on kind of what's going on with Active Pure. We are currently finishing up our annual maintenance program, which we anticipate will be done by the end of next week. So it's an annual process where we come out and just change the cells out, check the devices, make sure everything's working. And then we'll also obviously wanted to come and update you on kind of some of the latest testing that we've done. We did testing here at McLennan at the jail a few years back, but we've also started to work in some other areas, and including healthcare, and wanted to provide you with some updates on the testing that we've done there. That includes also some peer-reviewed published papers, which is really, really helpful when you're validating the data that we're providing. So I wanted to introduce Amy Carenza. Amy is our Chief Commercial Officer, and she's very involved with the healthcare side as well. So she's going to do a presentation and share some of those results.
Okay, and there's screens around, and then we see a screen right here in front of y'all, so go ahead.
Thank you. Judge Felton, members of the court, thank you for having us. And as the title implies, this is really about McLennan County's leadership and innovation in public health. And so we're going to talk about what you've already achieved. We're going to talk about how that has led to ongoing clinical discoveries, findings, peer-reviewed publications. This is really a moment for this court and this leadership team to feel proud of what you've done, and perhaps even explore other ways to use this technology. And Clark told me I have 20 minutes, but I assume nobody's mad if I go quicker. But I will keep my remarks to under that time frame. I thought it would help nobody wants to go back to the pandemic, but sometimes it's helpful to remember where we were to understand how we got here. I like this chart. The font's a little small, but this is a chart from the CDC. And in 2020, when we were all determining how we were going to protect public health, every single county official the world over was faced with a quandary, which is you have a pandemic that can spread in 15 minutes. In the case of your correctional facilities, you have densely occupied spaces. And here's the CDC giving advice to go to 6 air changes per hour, which means you would still have around an hour of contaminated air around every single person. So the status quo was not getting the job done by all accounts. And meanwhile, when you look at the energy profile for all of your buildings, you're already spending 40% of your energy in heating, cooling, and ventilation. So the powers that be were saying, why don't you increase your ventilation 4x, 6x times? Meanwhile, you already have an energy footprint that is overly dedicated to ventilation. So again, it was creating a quandary. The county made the wise decision to invest in Active Pure technology. And real quick, what this technology does is recreate the process of photolysis. So photolysis, Mother Nature designed that. We can't take credit for that, but what we have figured out how to do is recreate that process indoors inside of an HVAC system. So photolysis is a big word, but it's essentially what happens in outdoor air. When the UV light from the sun breaks down the humidity in the air and converts that into oxidative molecules, which can intercept all forms of contamination, whether it be viruses, bacteria, fungi, mold, and remediate that in the air, also remediate it on surfaces. And so the county explored the implementation of this technology in your jails. This is what it looks like installed, by the way. This is from our booth at ASHRAE. And Clark, how many of these do we have across the correctional facilities?
We probably have about 250.
So 250 devices installed on the supply side of your HVAC all throughout. And by doing that, you are bringing into the cell areas, into the community areas, into the break rooms for the employees. You are bringing in this continuous and persistent decontamination. And to test exactly the potential of this technology, we set up a field study before we installed. And what you see on the left-hand side there, that is the baseline. So we went in and we swabbed the floors, we swabbed surfaces, we took air samples. And what we like to do is survey the total amount of bacteria and fungi that's both in the air and on surfaces. And that's kind of our proxy for what is the biological contamination load in the system. And so after we installed, we came back a month later, and you can see across every category, both surface and airborne bacteria and fungi, you had in the air over 77% declines, but on surfaces, you saw over 95% declines in most cases. So this was a great validation of the technology at work in your facilities. But I want to keep going here because while these field studies, and I also want to give McLennan credit because the results, what we observed there, we went on to set up more robust clinical trials so that we could get both peer-reviewed and published, because we are a technology that is in the throes of innovation, in the throes of commercialization. So proving that it works once is great, but you got to prove it over and over and over again, and in increasingly difficult situations. And so that's what we did. So we set up a series of clinical trials in ICUs. And ICUs for two reasons. Number one, you have your most vulnerable populations. But number two, you have your highest levels of ventilation and filtration. So we wanted to go into the environments where the status quo remediation was already at its highest level and say, if we can make a difference there, we truly can say we can complement any environment to bring about a sustainable and persistent reduction in infections. And just real quick, healthcare-acquired infections, for those who aren't aware, about 1 out of every 25 people in America will at some point acquire an infection going into a health system for one condition, coming out with something else. It has very high associated morbidity and extremely high associated mortality. In fact, every 5 minutes, someone in the US dies from a healthcare associated infection. And even if you don't succumb to the infection, odds are you will be debilitated for life. They can be very debilitating situations. So this is why we wanted to take this technology, put it in situations where we know we can have a meaningful impact on morbidity and mortality. So we went into 2 different ICUs, and to kind of give away a little bit of the headline here, what we were able to prove through these studies has since been peer-reviewed and published in the American Journal of Infection Control. And for anyone in the court who would like to read this article, be very happy to share it with you. But it's the exact same technology that is in your correctional facilities today that we installed inside these 2 ICUs. One ICU was with Ochsner Health System in Louisiana. The other ICU was in the VA hospital in Lexington, Kentucky. This is just one graphic from the paper, but you can see we went into these ICUs similar to what we did in McLennan County Jail. We swabbed a bunch of surfaces. We looked at what the mean amount of MRSA, which is that highly resistant form of staph bacteria, we looked at what the mean levels of MRSA were throughout the ICU, which, as you can see, it was there, and it was there in about 95% of swabs that we did. But after we installed the technology, we had a statistically significant decline in the MRSA, which we sustained for the length of the study. Here's just a quick, this, again, I apologize, the graphics are much easier to read in the paper, but you can see here the picture on your left, wherever you see red circles, that's where this is the baseline ICU. That's where we found MRSA in excess of 500 CFUs, which is known to be a high infection risk. The right side of your screen is after we had been installed for 90 days, and you can see there's only one red circle there, and that is on the bed rail of a patient who is actively fighting a MRSA infection. Otherwise, we had been able to sustainably eliminate it from the environment. Here's the real headline, though. In both ICUs, we saw a greater than 70% decline in healthcare-associated infections. Now, Clark told me an anecdote, I think from last summer, where there might have been a COVID outbreak inside some of the court administration buildings where a lot of employees are inside the jail. And so that is an anecdote, right? It's hard to get something like that published, but this is a clinical trial. And this is a clinical trial with 60 months of longitudinal data and with replication. So in both ICUs with over 60 months of longitudinal data, we sustained a 70% decline in healthcare acquired infections. We've done other work in long-term care centers, specifically looking at COVID, and that was, this is a graph from that study. In the case of a long-term care center, which I know you guys have some wonderful skilled nursing centers here in Waco, we were able to see a 94% reduction in COVID cases between the winter surge of 2022 and the winter surge of 2023. And that compared to, we had a control center, they saw a 48% increase. So why am I telling you all this? I'm telling you all this because what McLennan County did, and this is really to your credit, because innovation requires courage, it requires adoption, and it requires taking and involving yourself in a scientific process. Since that time, we've gone on and we've been able to validate that science in much more rigorous studies that have been peer-reviewed and published. So I'd be very happy to talk about any of those clinical findings, and also if there is anything else inside of the county that represents a public health concern. I want you to have the confidence that you have a solution, whether it be tuberculosis or other types of migratory disease that we're starting to see, or if it's looking at how can we do more for our county hospitals. We're very interested, and we're here to help, and thank you for your partnership these last few years. Yes, questions?
On this particular slide right here, on the right side, what is the 48% increase represent?
Great question. So we looked at cases of COVID per 1,000 resident days. And what we saw was in the pre-activation period, which is on the left side. So the blue bar is the intervention center. It's the skilled nursing center that got the technology installed. The orange bar was a control center. This was a skilled nursing center, same company, about an hour to the east of our intervention center. And so after we installed that winter, COVID cases went from 10 per 1,000 resident days to 0.64. For the center that didn't have the technology, they saw cases go from 9.5 the prior year to 14. So, it's always good to have controls as we've learned through this clinical research, because whenever you have good data, people assume it's an anomaly. So we have, in the course of our clinical research, partnered and coupled what we're finding with a control, usually a blinded control that doesn't have the benefit of our technology, just so we can show what is happening without the technology. So we're very pleased by this. To see those reductions on a standalone basis is great, but knowing that the other centers actually had a higher occurrence of infections relative to the year before made it even more validating. That's all I had, but I would be very happy to take more questions. Got that done in 13 minutes.
Has technology changed since we implemented in the jails here? Has it changed any? Is it still the same?
It is still the same. So what has really changed, if you will, is the repository of clinical data. So the exact same technology that is inside your systems today is what was used in these hospital trials, what was used in these skilled nursing trials. So rest assured, you have the best of what we have. But part of the reason why we're all working so hard to get this data published is for our early adopters like yourself to have the benefit of knowing you were on the right side of history with this choice. So.
We have added some new products that have the technology. So whether it's a modular wall unit that you can place on the wall, or a dual device with a 9-inch cell versus the 14 or 5. So we've added some products to the mix just so we can, you know, create more value overall, but also just more, you know, options when it comes to how we design a space and what we decide to integrate in that space. So.
Maybe I'm wrong, but it would seem to be, and you validated here with your, that in controlled environments where you're testing, that air quality and maybe even surface quality would be more valid than patients getting sick or not sick. From a standpoint, like in the jail, that population may not be the same in 30 days that was there the first time you tested. So you don't know what somebody's coming in with or leaving with. But air quality is static. It's going to be there every day, every hour, every minute, every second.
Right.
So it seems to be a much more valid affirmation of the process.
That's a great point. And to build on that point, an infection inside of your jail today isn't going to necessarily stay inside your jail. And that's why this investment, in my mind, really is a public health investment. And to your point, what we want to prove with these, with all of these studies, in the case of the skilled nursing, your average residence was close to 300 days. So we did have a fairly consistent population. But you have all sorts of varying degrees of physiological reserves, right? No individual person is the same. What we want to demonstrate is that all things being equal, when you have better environmental competency and better environmental quality, you can avoid a much higher percentage of infections than if you didn't have it, right? So you can't rule them out entirely, but if you can stop the acquisition of infection, for example, with your employees who are working in these correctional facilities, from an inmate who is only going to be there for 15 or 16 days, that is a win for the county across multiple categories. So that's our goal, is we want to arrest avoidable infections in every situation that we can.
We're at the end of our free trial, is what it seems like to me. What is the cost going forward? What do we need to do to continue?
Well, we're actually in the
with this?
process of changing out all of the cells for everything that is currently installed. And is this the last year of our maintenance agreement?
It is. It is.
And so then we would very much like to work with the county on continuing the maintenance, because you have a 10-year useful life of that equipment, so long as you're meeting with the annual maintenance, which we've negotiated to, I believe, a very reasonable.
About 10 cents a square foot. Yeah, so it's really 330,000 square feet, so it's about 33,000.
And that just keeps the equipment operating at an optimal.
Absolutely, absolutely, because, yeah.
That cell that you see right there, the glow, so that is what is currently being changed out in every single unit. We unplug that from the ballast and we put a new one in, because it's on 24/7, and the bulb has about a 9,000 hour life. So as the bulb starts to degrade, because we use essentially the energy from the light amplified by the catalyst to induce that photolysis reaction. So as the bulb life wanes, we need to replace that cell so that you can maintain full efficacy with the equipment.
Are the number of cells that are installed based on square footage?
Yes, sir.
That's how it's determined?
Yes. You square feet or cubic feet?
We use cubic feet, but I just, for purposes of his question, I didn't want to overcomplicate it. Yes, we have to look at the cubic.
Smart guy.
I mean, square feet is a part of it, also ceiling height. But it is a dimension of it.
And we do look at, occupancy level as well, because a crowded space versus an empty space, so like a residential setting is different than a commercial setting, a school setting, for those very reasons. So we put more technology into the higher density spaces just to make sure we're able to cover that.
Yes, your jails are designed like a hospital would be because you have the highest density. So the way that, and we have about 40 different design criteria that our engineers use. Every single design is bespoke to the HVAC system. So what you have though is to the same rigor as the ICU studies that you saw.
So, I'm interested in knowing if we've done any analysis on our health statistics actually at the jail from before we went under this contract and installed this equipment to where we are now. Can we show any, do we have a return on investment analysis of that specific place?
We would love that information as well, and I think there's a few categories that we could look at. I think absenteeism and this wouldn't be HIPAA because you're not providing healthcare services in that capacity. So you would, I think, in the case of your jail, you would want to look at your absenteeism. You would want to look at overtime wages because that's where I think you're going to see your ROI.
So you're talking about the employees, right?
And I think you could also look at what that's a very good point, what you're spending to care for infirmed inmates. If we can get that in.
Have a set amount, isn't it?
No, so, all right, for an example, through the year, you're gonna have, just like in the regular population, colds, flus, those things, and then they drop off and this and that. So, you know, I guess the things to look at is the activity in the infirmary.
Yes.
The pharmaceuticals and the trips to the hospital. And
Yes.
it could be, you know, jail would tell you many more than that. But I'm just wondering if we've seen any evidence specific to what we're paying money for this location.
So that is a great point, and that is analysis that we have not had information to be able to do. We did that just for the sake of comparison. We did that analysis with our skilled nursing center, and we saw a 20% decline in unplanned hospital transfers. So there were things.
Kind of information.
Exactly. There were things we could see. Is there someone, I think this data hasn't been brought forward because we didn't know it was an interest to the court, but seeing that it is, we would love to get, I mean, this kind of information is always interesting to me. And if we have something that shows a significant finding, this is something that should be put forth in a public health journal. I mean,
Yeah.
I'm very interested in publishing as much of this science as we can.
Yeah.
Our chief is in the back.
Hi, Chief.
Would you?
Okay, that would be great.
Now,
I'm here all day.
If you set the meeting up and a guy named David's in the meeting, be prepared to be challenged on your statistics. Just
I'd record it.
Okay.
Back to the jail population, though, there again, you're talking about a population versus employees that's much more difficult to manage. We're not gonna ask them to stay longer.
Right, right, exactly.
It's the same way with the hospital. You've got the staff, and then you've got the patients in and out. I mean, I don't say, I would say that the workforce is probably, they're there all the time, so they're gonna be exposed to everything.
We have an average.
That would be one good study, and then the other one would be is there a way to?
Statistically show.
Yeah, does it statistically show man days in the jail, man, woman days in the jail, inmates in jail? Did we make any impact on them? I mean, it is important if it makes an impact on employees for sure. But also, the big expense is they have insurance. Our employees do. We bore the burden of medical treatment to everybody else. And so that's where our money's spent. So if we're spending money to cut that back, I'd like to know if it's working, if that can be found.
I would love to do that analysis.
We should have a data of what the average stay for an inmate
Oh, yeah,
is.
yeah.
So, I mean, and then you could you could deduce from that whether it's more like a hospital or more like a nursing
It
home.
would
And
be-
I would think it's
yeah.
more like a hospital.
I agree. I think that's
And
exactly
so-
right. The study they did that showed success in the hospital.
Hospital, yeah.
It might be what
go
you
to that.
compare to, but it's just,
We
if
can
I'm
also
talking
pull
to a
the pharmacy
taxpayer,
logs.
if I'm talking to a taxpayer and we're spending this money and they said,
Mm-hmm.
how do you know it made an improvement? Well, I know it made an improvement in the hospital.
Pharmacy,
And so, well, what has it done for, I mean, if we have that information, it gives us more.
less antibiotics.
Yeah.
Yes. So the pharmacy logs will be a great way because you have to log that no matter what. And based upon what's prescribed, we know if it's an acute versus chronic condition. So what was an
Yeah.
infection? And
Right,
so
which-
we can isolate what
Big
acute
difference.
infection spending has been.
These folks, they don't just arrest healthy people.
Right, right.
And most of them really haven't taken good care of themselves. So, yeah, that chronic.
Did you put the ICU,
There it is.
Yes. And Ken, I will send a copy of the article, the AGIC article. I'm one of about 6 co-authors on this article, but if anyone has questions on it, I'd be very happy to go in depth with the research with anyone.
You know, and at the time that we were doing the studies and the testings on this, I know there was a staff issue out there, and I'm not talking about staff, I'm talking about staff infection.
Yeah.
And I don't know, I know it went down, I don't know to what extent, but I do.
staff air, does staff spread through the air?
So it aerosolizes. When you think about transmission, you, and there's.
I thought it was on surface.
It's on surfaces, but it gets dusted up through touching, through movement, and so it can aerosolize and then it resettles. And so this is where, I mean, there have been some studies done that have shown, Pseudomonas in a patient's room, and they can track it to the cafeteria. And you're like, well, how in the world is that happening? And it's because it aerosolizes and it gets on the floor, and then it gets on a caregiver's shoes, and then that caregiver walks through the hospital. And so part of what why we have seen, in my mind, such a tremendous improvement in the state of the art of infection prevention is that this technology is continuously at work. So when that re-aerosolization occurs, again, you're able to intercept it. And you have molecules that are heavy enough to settle on the surface and react and decontaminate contamination on the surface. So you kind of have to have something that holistic and that continuous if you're gonna like even the odds in the fight. Because in an ICU, the contamination levels are just so much higher than what you can handle through a traditional HVAC system.
You're going to send us the contact information, or how to read the journal?
Yes, I will just send a copy of.
Is this what was in the journal?
It
This
is.
was it, right here.
This is, in my mind, this is the headline graph, but the journal article is about 10 pages long of our materials, our methods, all of our findings.
And in it, it'll explain the acronyms on what.
Yes, so CODI, that is a urinary tract infection. CLABSI is a central bloodline infection. C. diff is any type of the C. difficile. That's a intestinal bacteria. And then your MRSA is your methicillin-resistant Staphylococcus aureus. That's your really resistant staph bacteria.
So I think, and what we're asking for here from the court is, the action is to approve the report for recording purposes. I would say that this is an opportunity for the company to do a case study of a jail, like a county jail, where it's not like a state jail, but a county jail that turns over all the time. And it would be, it'd be a benefit to y'all
I
to
agree.
help us understand what kind of benefit we got. And, we would be the case study for y'all, just like you did the hospitals and those kind of things. And then, the chief could give an endorsement.
I love this idea.
He didn't like me speaking for him. And I don't blame him. But anyhow, I can see where y'all could benefit, but it appears it's really benefiting us,
It would.
so.
Well, you know, if it benefits us from our employees not getting sick and
Yeah.
taking days off, which affects I'm sure our insurance rate at some point in time,
We're gonna find
health
out.
insurance, that it's a win-win for us.
Yeah, we're gonna find out
We're
about
gonna
that.
find out here in a
Pretty
minute,
good,
so,
in my opinion.
yeah.
Okay.
Thank you for that opportunity. You know, with healthcare providers, the ROI is a little more imminent, but it takes leadership and vision to really dig in and understand the big picture and help us tell the story. So we appreciate that opportunity.
There's a big
Put
picture
all the
there.
footnotes you want in it, that, you know, disclaimers, that this is different, it's hard to get, or whatever, but at least, you know, what is obvious, then we would know what those
What
things are.
conclusions you can draw from it.
Yeah, you know, conclusions you feel comfortable in.
And if it bears out as we suspect it will.
Yeah.
We'd love to be a partner with you guys. Every other county that could do it,
Yes.
we'd love to.
Yeah.
To see that implemented other places as well. So.
We would too. Wonderful.
Okay.
Thank you.
Any other questions or comments?
Great presentation.
All right, is there a motion to approve this report for recording purposes?
Motion to approve.
Second.
Have a motion, second, any other discussion? No other discussion, all in favor say aye.
Aye.
Opposed? Pass. Thank you.
Thank y'all very much.
Appreciate you guys.
Thank you.
Hey, Dustin, if you would take us through about 10, we're gonna have to recess at 10, a little bit before 10 or a minute before 10. If we can get some items out of the way in the next 10 minutes, and then we'll recess briefly, and then we'll come back with Randy being next on the show. Okay?
Okay, well then, if it's all right, we'll just jump back up to the pulls from the consent agenda, and so no actions needed on E3A. On
Okay.
E3B, this is a HR matter for Road and Bridge Precinct 4. Anna?
I could just say as Anna's coming up here because we've done this in the past and
Yeah,
it benefits
there's
us
no
and we
need
need
for
people that,
explanation.
my motion would be to approve E3B.
Second.
All right, I have a motion and a second.
Thank you, guys.
Yeah,
Appreciate that.
yeah.
Well, it's needed. I mean, I know what's going on right now.
Yeah, and we have a motion and a second, and we are, if you don't know, we're in a heck of a mess because of floods and other storms that have, and we're at the beginning of our summer work, and these precincts are almost underwater from a workforce, workload standpoint, and so I support this as well. So we have a motion.
Donna agrees?
Donna agrees, right? So we have a motion and a second. No other discussion. All in favor say aye.
Aye.
Opposed? Pass. Thank you, Anna, for a great presentation.
Yes.
You said you wanted to move along, Judge. You
Yeah.
said you wanted to move along.
Short and sweet, might be my shortest stint.
All right, moving on to item F. F1 is authorization of surveying and engineering proposal with GLS for Texas A&M AgriLife Extension Service paving improvements. Zane?
Yes, sir. So this is a proposal for GLS, a new local engineering and surveying firm, to do the AgriLife Cobb's Drive facility parking lot design of improving their parking lot with a paving design. The amount is $37,900, and it's recommended for approval. Any questions, I'd be happy to answer.
Is this the actual paving or just the design to get it ready to pave?
It's, right, designed to determine whether we need to overlay it, chip seal it, dig it up, remove it, replace it, just seal it with a fog seal, but they're going to put together the plans and specifications so that we can bid the work out to have a construction contractor come in and do the work. Their price to do the design plans, bid it out, assist us with construction administration is $37,900.
They'll babysit it all the way through.
Yes,
They'll babysit it all the way through the.
correct.
Okay.
You know, and it's not that big a parking lot.
Yeah,
That's
I
the
don't
only thing
understand.
That
Go ahead.
21,000 for civil engineering, and it's just not that big of a parking lot. I'm just struggling with.
When we talk about
Square
core,
feet, how many square feet is that parking lot? Do we know off the top?
I don't know off the top of my head. I can get back to you on that.
So I think that would be good to know if this kind of comes in within, I mean, you're talking are we talking a couple $100,000 to do the project, or,
So if they come back with something simple like a fog seal or just a slurry seal, you're probably talking $75,000. If it's a mill and overlay, yeah, it's going to be probably 150,000, 200,000.
But you don't think that we could just bid this out and people that do this every day for a living could go in and tell us, say, here's what I think we need to do, and
If we decide to just fog seal it or slurry seal it, potentially, yes. If we decide to mill and overlay, then it would need to have a set of plans.
Is it asphalt?
Yes. Asphalt parking lot. And the parking lot is in the front of the AgriLife building, down the side of the IT building, down the back of the IT building, and then potentially across that portion of that's enclosed with the chain link fence.
And all of that needs to be replaced. All of it's used extensively.
Well, it's all falling apart, so
Yeah, it's rough.
it depends on
It's
whether
falling apart.
whether you want to replace it or improve it or just let it fall apart to just gravel road, I guess.
And I don't think we want that.
No, there's a lot of people in and out of that building.
I would like, before we move forward with this, I would kind of like to get an idea on if we did a total overlay, what does that look like? If we did a slurry seal, what does that look like? Because I'd hate to do 37.9 of planning when somebody could just go in there and say, hey, we're just gonna do a chip seal on it, and we're gonna be done. And I don't know what you'd be looking at. You're probably looking at, I don't know, maybe 50,000 or so on a chip seal somewhere in there, but you're almost spending more on planning than you are on the actual project, I guess, is what I'm.
And then we're still talking about what we're gonna do over on our fairground property.
So is there any way you could get us ideas on if we chose to go with a?
Well, this was part of the project. This was part of their contract, was for them to give us prices and what it's going to cost, and also do the actual plans. So they would come back and say, if you did a fog seal, it would cost this much, and we would provide plans to do that. If you did a chip seal, same thing. If you did a mill and overlay, same thing. So they're going to bring to us the options.
Because it's not a high-traffic area.
It's not a high
So
traffic
whatever we
area.
do should last a reasonable amount of time.
So it's got some cracks, it's got some base failures. If we simply just fog seal it, slurry seal it, you're just putting a light glue on top that will fill the cracks and voids and crevices so that when it rains, that doesn't get into the base. And that's the most inexpensive way of handling it. However, you're only getting maybe 4 to 5 to 6, at most 6 years of service. If you mill and overlay it, you're going to get another 10 to 15 years. So you want to pay now just a little, or pay now a lot and get more service life.
And just as a statement, was it my understanding that trailers go around back and turn around?
Yeah, used to,
It had heavy traffic one time.
yeah, and that's where, goosenecks, like, during the, people, they provide resources to agriculture producers but also 4-H and those things that maybe come in there for various reasons and have trailers, and then they go back there and turn. And so those wheels pivot around, and that puts a lot of pressure on. It may even be a thought that you treat the very back different than you do just the regular parking, but.
Well, one of the reasons I'm bringing this up is at EOAC, we're having to redo the parking lot on Valley Mills where our new building is. And it's a bigger parking lot than what we're dealing with here. And we've got, we had bids come in, and 60 grand was our low bid. But we don't have anybody, there's no consultants, there's no engineers or anything involved. It's just we've got a company that's come out and said, hey, here's what we recommend, here's what we can do. And it's a bigger parking lot, so I'm
Good
just.
reputable company that
Right.
you trust.
So
Well,
anyway,
They giving you a warranty on it?
and I'm assuming we'll get something on that of some kind there, but.
And what exactly did they do? They mill and overlay?
They came in, and what they did is they looked, now they're gonna do they're gonna mill over it, and then the back section, which won't get used much. It's 142 parking spots, so it's big. So the back 25%, they're just gonna slurry seal it. Okay? And then
So Commissioner, Zane needs some direction, so I'm gonna recommend that we defer and by the next meeting, let's decide so he can, he understands what we want because,
well, and that might be a good process because maybe we're not getting what we thought we were at EOAC. So I would like to see this through because one way or the other, I want to make sure.
I don't disagree with you. The thing that, of course, just jumps out at you is that civil engineering cost in comparison to everything else.
Yeah. Okay.
Are there any drainage issues there, Zane, that you're aware of or anything?
I believe it drains just fine.
Okay.
I've been there after a big rain and it drains fine.
Okay.
I don't mind helping out. It's in my precinct and I'd be more than willing to talk to if you know.
And that's what we talked about initially, but the workload that you guys have right now is pretty huge through the summer, but so I'm gonna make a motion, we defer. If we get a second, then we'll hold it, and then y'all talk and figure out what you wanna do, and so we can give him some guidance.
Right.
He's trying to get direction.
And that's what's just piqued my interest here is that, all right, I've got one entity I'm with and we're doing it this way.
Yeah.
And maybe we need to change our thought process on that, so.
Second the motion.
All right, we have a motion, second, any discussion? No other discussion, all in favor say aye. Aye. Opposed, pass. I want to recess for 10 minutes. I think he's got you set up upstairs.
Appreciate it.
which we're sharing now.
Yeah, David, you know, she and David could really converse well.
Excited about meeting him.
That mint sure was good.
Good.
I'm still hungry.
The free ones are better, aren't they?
Yeah, that always tastes better.
Is anybody in?
Recording in progress.
Thank you. All right, let's call court back into session. It is 10:21. The recess took a little longer than we had planned, but, all right. So at this time, we have Randy McGraw here with Hub International to give us an overview of our health insurance plan and give us an idea about any advice that he might have, and along with Anna, in moving forward into this next year. So, welcome.
Thank you. M4, right?
Yes, this is item M4. And everybody has a handout, and I think there's,
Yes.
Is the same handout going to be on the screen?
Yes, sir.
Okay.
I think Anna's bringing up the presentation.
Okay.
So I'm Randy McGraw with Hub International, and it's a pleasure to be back in Waco. We were here just a couple weeks ago, actually, too. Lots of meetings and lots of information. And I'm here to review the update, and I know you're about to enter your budget cycle.
Yes.
And so with that, we'll just kind of dive in, and if we can go to the 2 pages away. I'll start off on the 3rd page, which is a summary of the inflation trends that we're seeing currently. There we go. And we'll see some charts and things as we go through, and several observations, but overall, the news looks good compared to the dialogue we were having this same time last year.
Yeah.
Much better. So the current annual pace of inflation, which is measured on a per-person basis, a 12-month moving average, on the medical claims expense is a negative 6.6%. And a year ago at this time, it was plus 34.9. So it's, I would say, bad news, good news. 34 was a lot higher than the 6 that it came down, but at least it's moving in the right direction. And on the prescription drug pharmacy side of the equation, we're currently plus 7%, and last year we were at plus 22. So things are clearing up, and it's primarily due to not as many severe, catastrophic, or high-cost claimants is what's causing what we're seeing in the inflation trends. And so
Randy,
this,
what's the time frame? What's your latest
sure.
data time set?
Yeah, this data is through the month of April, and toward the end of this week, we'll get an update from United Healthcare that we'll be able to update through the month of May. And of course, we'll update it right away. So there you can see that how high the inflation had gotten, and especially on prescription drugs, where they pretty well almost doubled in the course of a year. And now we're down in the overall combined pace of inflation for the health plan is in negative territory as well. It's about minus 2% total. So there's not a whole lot of plan sponsors that can look at their data like this, and especially on, or see the results that you're seeing. And especially on the prescription drug expense, that's a category where historically, year over year, prescription drug costs just continue to go up, and they're still continuing to go up. But we've seen most of our clients are seeing prescription drug inflation even right now, somewhere in the 14% range. So part of that, being at 7 is, it was just so high to begin with that it's good to be back down in the 7 category. The next page is important. So through the first 4 months of the year, in that second bullet point, there's nobody who's in excess of our stop-loss deductible. And historically, we would have one or two people that have already had some catastrophic claims, and there's only currently two people in excess of $100,000 total for themselves through the year. So again, this is good and welcome news. And the other important takeaway on this page as well is at the bottom, and that's where we're tracking the average discount rate, and that would be the rate that United Healthcare negotiates with hospitals and doctors, a discount from their billed charge. And so you can see, and it was 2021 when we first started doing business with United Healthcare. And prior to that, under Scott and White's administration, our average discount was in the high 40s or the low 50s. And so to see it up in the over 60%, and we finished 2023 at a 63.8%, that's been a huge contributor to the improvement in the performance of the health plan. And if we move on to our next page, this is just a straight line projection of the claims expense. So in other words, it's not being factored in for inflation. It's just taking the first 4 months of the year times 3. And you can see we're on track to have our claims expense be almost identical to where it was last year. And then, of course, for 2024, we made substantial changes to the benefit plan and to the contributions to the benefit plan, as well as contributions to health savings account for your employees. And I would call that a quantum shift in your information. So a couple weeks ago, we were here, and I got to sit in Commissioner Jones's chair and watch that screen. But we were going over the annual review with United Healthcare, and the information, you know, they were going over how things looked in the last year and all these other things, and we were talking about prescription drugs and co-pays and things that we could consider. But what they were not taking into consideration in that dialogue was the fact that now, on January 1st of 2024, more than half of your population is now in the consumer-driven health plan, which was our objective last year with the changes that we made. And I wanted to say, and I had said it even in our committee meetings too, appreciate the trust and confidence that you place in the recommendation. It was a bold move. We lowered the high deductible health plan deductible, increased contributions to the HSA to $2,000. It's got to be the best benefit of any county here in the state of Texas right now in terms of worst case out-of-pocket expense. But we can see that, you'll see it in a couple of the graphs coming up. On the next page.
Back on that same page.
Sure.
Average employee census, the 1032 is the number of employees.
Yes, sir.
That we have in the county.
It's actually employees and retirees. We just labeled it.
Right, okay.
Yeah.
And then average member census, that's how many employees, like with their families?
Correct.
That gets you to the 1620.
Yes, sir. That's members includes all the spouses and
Okay.
children too.
Okay.
On the next page, this is just showing our monthly claims expense. And you can see we started off, 2024 is on the right-hand side. I would say January was about average, but claims paid in January are coming out of December and November. February, we had a pretty significant drop in claims, and part of that's due to the high deductible health plan as people are satisfying their deductible. And then you can see it creeping up in the next couple of months. And so, you know, my concern is, especially looking at the last month, was, well, that was pretty substantial higher than March. And then the question becomes, well, is it going to keep going in that direction, or how is this going to impact the forecast looking forward? And so one of the things in the approach for the forecasting is, I'd say it's kind of like handicapping horse racing. You just look at the most recent information that you have, and you base your decisions off of the most current data. And so we're always looking at a rolling 12-month time period. So as that 12-month time period moves forward, you'll see, if we look back, there's some pretty big months in there that are going to roll out of this equation. And so even though there's a big month in the month of April compared to the other parts of the year, we're going to see some even larger months roll out of the equation. So even if we see May come in at the same level as April, I'm not concerned, and you'll see on the trend reports how, how that's going to shake out. But as the time period moves forward, some of that old scary information rolls out of the picture.
But in general, I mean, there's obviously an increase in the fourth quarter, and you're not worried about that trend getting out of hand or going up too much. I mean, there's sometimes you just never know. But
So I think, too, and we talked about that in our committee meeting that we
Right,
had
and I wanted to-
like a week or so ago as
Yeah.
well, is that I would call it the magic of the consumer-driven health plan.
Sure.
So there's the math part, which is I have a big deductible, and you're not going to pay a claim until I meet my deductible, and you can calculate that pretty easy. But the magic part is the changes in people's behavior as they become accustomed to having more skin in the game up front. And granted, the county's been generous in giving them $2,000 to go towards their
They've saved that.
$3,000 deductible. But once it becomes their money, which it is when you give it to them, then their whole attitude changes when it comes time to spend their money. And that's what drives the behavior. And we'll see that progress as we go forward through time. And we've seen it in a lot of our other clients as well that have gone through some of the same shifts that you've done. The page number 8 is our dashboard report. And this is this one gives you, if you're an underwriter, this page has just about everything you want to know about your utilization, with the exception of high claims data. And so the thing we can look at too in that, over on the right-hand side, where it has census data, it's showing looks like I'm missing a label. So it's showing the total number of people by plan. That first row going down is just breaking down the data by medical and pharmacy expense. And then the second section breaks down costs by relationship, by employees, and employees can include retirees, spouses in a separate category, and children in a separate category. And then the next quadrant down below is, the enrollment by plan, and these are in the total members. So if we look in that plan category, in 22 we had 500 members in the high deductible plan, then 533 in 23, and in 24 we're at 923. So that's the quantum shift that I like to refer to it as. And if we look over to the right-hand block of columns from there too, you can see the breakout. I like to look at the subscriber, spouse, and child categories. So historically, spousal claims are pretty high, and it's just by design because sometimes your spouse enrolls in the plan, sometimes they don't. But all of your employees pretty well enroll in the plan. And so in looking back over the prior years, you can see that the spousal claims on a per-person basis have been higher than employees. And this year we're starting off lower, which is good. And even the employee cost is lower than the prior year. Children is up a little bit, and sometimes that's just due to a large claim that comes in there. But historically, I would say that, the new norm for the average cost of a kid is probably around 200, so we're still a little bit high in the child category. But overall, that's good, and children are good risk compared to the rest of the population, so it's good to have them in the plan. And then down at the very bottom, lower left-hand corner is where you can see the breakout by different categories, your active population, your retirees, and these retirees are primarily under age 65, not eligible for Medicare. Once they age into Medicare, then they roll off the self-funded plan and move into a fully insured plan that you also have with United Healthcare. And then you just have a couple of straggler retirees that weren't eligible for Medicare, and so they're still continuing on your plan, and you can see that the retiree costs are up pretty high. And our COBRA expense is down low. That's good to see that. So pretty much every way you look at it, things are looking good. On page 9, this is the breakout of our high-cost claimants. And again, so far, only 2 people in the first third of the year have exceeded $100,000. and the county carries a deductible of $175,000. So we'll probably see maybe these two claimants get past the deductible, but we don't have anybody racing past it. And you can see how many people historically have met the deductible too on that first row in the bottom. So last year there were 3 people in excess of that. The year prior was 7, and then 1. So things are looking good.
Is that
health
number
plans.
determined by the county, that 175? Is that something that we
Yes,
choose?
sir.
So we can choose to lower it or raise it?
Correct.
And it would affect?
Yep, so it's like any other insurance product, if we lower the deductible, the premium goes up. And but if we raise the deductible, the premium goes down, but our liability goes up. So at renewal time, or even when we're in bids, we typically ask for multiple levels of deductible. And then I would just describe it as finding the sweet spot.
Right.
Because there's, I could give an example.
How much pain can you stand?
Yeah, so here on our stop-loss premium, we pay right about $1 million this year. And then in the case of another one of our clients, the city of Amarillo, there's 2,000 employees there, and they carry a stop-loss deductible of $700,000. So they're on the hook for the first $700,000, and their premium is only about $60,000 in a year. It's very, very low because the deductible is so high. But if we ever had, 2 or 3 claims at one, each claim is $700,000 liability to the county. And so and they go out to bid every year on the stop loss, which the county can do that too, because you're self-insured. You don't have to, it's not like, your battery went out on your car. You don't need to get a new car. You just get a new battery. So we can always bid the stop loss out by itself. But in the case of Amarillo, nobody ever wants to bid because there's not enough premium to cover a loss. So if they might say, well, I'll bid, $60,000, but one claim could them $1 million.
Yeah.
So there's a sweet spot in the marketplace. You don't want to get the deductible too high.
Right.
Because then they don't feel like they get enough money to cover the risk. And if you set it too low, then underwriters are untrusting, suspectful people, and they figure the only reason you wanted to lower your deductible because you're about to have a claim, and so therefore they want to raise the premium anytime they see you acting like you're running for cover there.
But you could give us historical data over the last 5 years on
Yes, sir.
a number that went over 175, and then we could look at the variables.
Sure.
And whether or not that would.
And then what we do too is, and even at renewal time, we'd say to United Healthcare, like, what's your renewal on the current deductible? What would it be if we raised it? And then you can measure, how much premium are they going to reduce versus the liability that's going to go up, and see if it's a fair trade. So every now and then they'll make a pretty fair trade. Most of the time, when you're trading with the insurance company, you don't win.
No, that's true. There's a reason there.
So the next couple pages are just some bar charts. Page number 10 is just showing your enrollment by plan. And there again, you can see 2024 is on the left-hand side. Majority of members are now in the consumer-driven health plan. And our next page, this is just looking back in time, and it goes back to, and these are all calendar years, not fiscal years, but it goes all the way back to 2018, and you can see the average cost per person was very stable up to 2021, and then it jumped in 22, 23, and we're retreating a little bit now, but probably never see those dollar amounts from back in the pre-pandemic era again. And then on the bottom portion, it just shows the total number of members covered under the plan over time. So 8 years ago, 6 years ago, you only had 1,400 members, and we're up to 1,620. The county's growing. And then, to me, I like this slide. This is why I say I appreciate your faith and confidence last year, because last year we weren't seeing the right-hand side of this, and this is just showing you the average cost per person in the consumer-driven health plan. versus your base plan. And the consumer-driven health plan is the green line, and the base plan is the blue line. And last year, I was telling you, if we can just get enough people into the consumer-driven health plan, we'll see these two lines cross. So what was happening in the history part was there wasn't a lot of enrollment, but every now and then when they got a large claim, it skews those results. But now that we're in critical mass category, you can see it started moving down before we crossed into January, but now that we're in January, it's staying down. And I think you'll see these two widen out. And the more they widen out, the more, the easier it will be to encourage people to move in that direction. And you're already there. You crossed that painful bridge last year with all the changes. But at your open enrollment fair, I think from my perception, the changes were well received. Everyone was excited about the high deductible health plan and the HSA contribution. And on that note, you're not obligated, once, the county can change its decision on how much to contribute to anything, including the HSA. So once you do it, you're not obligated to continue it. I realize that once you do it, it's hard to take something away. But things will be changing over time too. And one of them is that the way we have the high deductible health plan set up is we make the individual deductible equal to what the government calls the minimum family deductible. And the reason for that is it avoids having to go into a 30-minute explanation of how those two concepts work.
It is really complicated.
It's simple for, an individual, because right now you can tell them your deductible is $3,000. Once you meet it, you're done. But if we set that deductible lower than that in a family, once they meet the $3,000, they're not done, because you can't get a benefit till you meet the family part. So by making the family the individual, then we eliminate that confusion. Now the challenge is, in what we had done previously, we had the deductible set at $3,500. And we had lowered it to $3,000, which was the minimum for 2024. And for 2025, the government is, we've lowered it to $3,200. And for 2025, they're going to raise the minimum family deductible $100. So in order to continue with our strategy, we'll have to increase the consumer-driven health plan deductible by $100. And then for the family coverage, it's 2 deductibles per family. So the family unit would go up by 200. So one, times 2 on the 100. So in this chart here, this is the detail part of the math going forward. And the important number is in the lower right-hand column. And some of the key takeaways there too is, even though we're currently in a pace of negative inflation, and the assumption we're assuming that it's going to at least go up 7% during the course of this year and in the course of next year. And that 7% is a blended average between the medical and the prescription drug. And that's pretty consistent with the norms that we see on a regional and a statewide basis. So there's a little bit of, if you could plug in like, well, we're currently at -2%. Why doesn't it say -2? Because that's not going to hold up. So we've got some extra padding in there to go forward. And then we're also predicting too that you'll be, a large part of the discussion last year and in years past was making sure we kept a healthy fund balance. And so at the start of your current year, you had $4.8 million, and we're going to be at 3.4, what we figure by December 31 of this year. But the target for the reserves is lower than that. It's only 2.2. So we've got more reserves than needed, but we don't want to get a whole lot of money and we don't want to have too much. We want to be like Little Red Riding Hood and have it just right. So the health plan is looking good. On the next page is the dental plan, and the dental plan's looking awesome. So again, in that
page.
Pardon me?
Back to the other.
Oh, sure.
Why is the projected reserve balance estimated to be lower for 25? What numbers are those based on, Randy, that causes that to be lower than the previous year?
So it's based on revenues versus expenses.
Revenue versus expense, okay.
And so there's like the starting amount of money.
Right.
Money comes in, money goes out, and then the difference, the balance either moves a little bit up or down.
Okay, thank you.
And so you could always, I mean, if you wanted to, at the, in our case here, we're using 2.4 months of claims paying capability as the reserve target. And there's, the County of El Paso, our client, sets their target at 90 days. So you could, I mean, whatever makes you comfortable, there's no statutory requirement that says you have to hold a certain amount of money, but it's just like your
But
general
it's
fund.
smart.
Yeah.
Right? We're at 2 point, what, say it again now? Versus
You started this year at 4.8, and 2.2 would be 2.5 months of claims paying capability.
2.5 months.
Yes.
2.5 months.
And that's about,
45.
so that's just to account for the
75 days.
incurred but not paid liabilities. And so with health insurance claims, there, you know, you go to the hospital, you have the bill. Most of the hospitals file their claims pretty quickly, but sometimes the larger bills are slower to go in and they get a higher level of scrutiny. So just because you had a claim in January doesn't mean it gets paid in January. It could get paid in February or March or August. So we're basically just switching from a cash accounting to accrued accounting, and anticipating that there's always about 2 months worth of claims in the pipeline, so that if we turned the plan off at the end of the year, you'd have bills coming in for another couple months. Although more and more claims are going through electronically these days, almost all of them. And artificial intelligence is jumping in there too to help speed things along. So 2.4 months, we've had some clients change administrators recently, and none of them have come close to seeing the full 2.4 months come out. But it's just good to have there in your fund. So there's going to be some big months and some small months, and it helps take the swing out. And there's not a situation where you're having to come back and transfer money from the general fund into the health fund. There's Cameron County, Brownsville is one of our clients. And they've been, when they hired us, they had been running a deficit in the health plan 4 years in a row. And we're entering our 4th year with them now, and they've never had an interest to have a fund balance. They just take money from the general fund and move it over to the health plan every year and zero it out and then start all over. So I've been trying to encourage them to build the fund, but it's their, I mean, it's their decision, their money, and they've been doing it. And then every year we have the same discussion. Why is it a deficit?
The 2.298/016.75 is the 2.4 you're saying?
Yes, sir.
Okay, and at that 2.4, there's an excess of 89, just under $90,000.
Correct.
So that 90,000 could be rolled back into.
You could move that to the general fund. I think it's close enough. I would just let it kind of ride, because it's going to float up and down. So the dental plan, not nearly as complicated. In the dental plan, we switched to a self-funded approach several years ago too, because really, if anything should be self-insured, it's dental and vision. And we self-insure both of them here. And the reason for that is insurance is to protect people from unpredictable catastrophic loss. And a dental claim or a vision claim is not that unpredictable, and it's not very catastrophic. So it really doesn't call for insurance. It just calls for good management. And the dental plan, by design, has a maximum benefit that it can pay in any given year. So you're never exposed to anything over, $1,500 or $2,000 on any one person. And so the majority of the money here is coming in from employees' payroll deductions. And we started this year off with a $300,000 reserve or fund balance, and we think it will float down to 260. But the recommended target's only 122,000. So you've got a lot of money in your dental fund account. And we had some discussions over, what are some things that we could do. And so some of the ones we kicked around too were, everybody likes to know, are implants covered? And the answer is no, they're typically not covered in a dental plan, and they can be pretty expensive. But it's not really a problem to add implant coverage if you want to, because again, the person's going to hit the calendar year maximum, and if with one implant, you'll ring the bell. So it's not like it's going to raise the cost, it's just making a benefit available that otherwise might not have been covered. So there's some things that you could consider doing with the excess money in the dental plan. You can move it back, I mean, it's your money, you can move it back to the general fund, or you can enhance the program, or
Well, I'll just float what I,
yeah, you could also use it to subsidize the cost for employees and make it less.
maybe we pay for the employees' dental coverage. So-
Can you run the numbers on that for us when
Sure.
you get a chance?
Yes, sir.
And any other
Taxpayer?
suggestions? Huh? Say what?
It's a philosophical issue I've got.
Yeah.
So the dental plans,
Well, I mean, this plan competes against, other employers' plans, things like that. And so, I mean,
so I would say, I just call it the good average dental plan, and that would be what practically every employer has. So which is usually a $50 deductible, 100% coverage for preventive care, 80% for basic care, 50% for major care.
taxpayers pay for a lot. So.
Yeah. So it's not catastrophic like the other one. And so, some of our clients have experimented too with raising the calendar year maximum from, I guess in the old days, $750 or $1,000 a year was considered a good benefit. Nowadays, $1,000 barely buys you a crown. So we're seeing more movement into like the $2,000 or $2,500 calendar year limit. And then a few years ago, MetLife, which writes a lot of dental insurance, had a marketing promotion where they would say, well, we're going to offer you a $5,000 calendar year maximum benefit, which sounds really great, but very few people ever rack up $5,000. So that's kind of like window dressing. You could raise the calendar year maximum, and it's not like everybody's going to be able to get out there and ring that bell. So it looks on paper like it's a lot, but how it actually impacts the plan is not near as costly as it might seem. Because you would think, well, if you're going to give me a $5,000 benefit, does that mean you're going to raise my premium $1,000 a year? No. So those are other things you could look at too. The calendar year maximum contributing to the health plan, things like that.
So, if there's like
Pardon?
a optical dispensary or on your glasses that does not take that insurance, then you can file a claim with them, I guess.
Yeah.
You do the work instead of the vendor doing the work of filing the claim. Same way on dental.
Yes.
Same.
That's what my dentist does. They don't.
So you file it?
But they actually file it for me. They're not on the plan, but they file it for me.
Yeah, I'm taking my wife to one now. We're looking at implants. And they don't accept insurance, but they'll file it for you, which is convenient. Otherwise, they'll just give you the bill and you send it in yourself.
Okay. So who handles that? Does HR help with that or not?
We'll send a faxer of a claim or for reimbursement on behalf of the employee, but it's not
Okay. Well,
a common occurrence.
Glasses I just bought.
So this page.
Yeah.
Okay.
Yeah. But the optical dispensary didn't.
Yeah.
Yeah.
So this page is just a summary of the heavier math. Top portion is the medical plan and the bottom portion is the dental. So this would be like the Cliff Notes version of the more complex math. And it just breaks it down. It all adds up to the same dollars. It's just like a summary report. So again, in the medical plan, looks like we have about $90,000 more than targeted. And in the dental plan, you've got a whole lot more. So you've got an easy another $62,000 that you could pull out of there and do whatever you want with. And then finally, just some closing comments again, is that the overall, I would say the improvement in the operation of the health plan is due to reduction in some of the high-cost claimants. And eventually, there'll be some more high-cost claimants that come around too. And then also made mention of the fact that we'll have to handle the change in the family deductible for the health plan. And then we've also been having, when United Healthcare came for their end-of-year meeting, they dumped an incredible amount of information on us, along with a pretty long laundry list of things for you to consider. And a lot of the things that fall in that category of things you can consider are different services that they would sell you.
Yeah.
And so we take those kind of with a grain of salt. So, but one of the hot topics that we've been discussing too, the concept that we're not ready to come back with a full recommendation, because it's only been a short amount of time. So they were pushing hard on making some changes on the prescription drug formulary, which, if you recall, when we went with United Healthcare in the first couple months, it was like mass protest. Nobody liked the drug formulary. Nobody wanted to go to Walgreens, all of those different types of things. And so in last year, they had also proposed making some changes in the drug formulary that would save some money. And then they have some drugs too in their new formulary that would move from one copay to another. And so they were pushing on this new drug formulary. We had them run the numbers for us, and they gave them to us just last week, which is why we're not ready to come today for recommendations. But the majority of the savings that they were showing from that changed formulary was really due to drugs moving from the middle copay to the highest copay. And so, but that's old news now, because most of the people don't have a copay. So they could probably care less if that drug went from the middle copay to the high copay, because under the consumer-driven health plan, your copay is your deductible. So even in looking at those statistics, it looks like, if you wanted to, you could switch to that. But the overall savings from that switch was less than $50,000, and it was going to aggravate 400 people. And so we're kind of inclined to say thanks, but no thanks to United Healthcare. We appreciate you can find ways to help us save money, but we're not sure that's the
Gets
one
in a
to do.
bad mood when 400 people call HR wanting to
and they'll do
explanation
Yeah.
why they're having to pay more.
But page 16.
It's all our fault.
Back to page 16.
Sure.
Budgeted funds for unfilled positions, $1.5 million.
Oh,
So
yeah,
we budget, in our budget, $1.5 million for positions that are never filled. Is that
Right.
what that's saying?
So that came from last year, the clarification of incorporating the vacant positions and budgeting for those in the health plan forecast.
But we don't pay it unless
No.
those are filled, so.
Exactly.
Oh, we don't pay it?
No,
Right.
sir.
So it's not figured in?
Well, it's there, it's budgeted in your fund account. You're just not spending it.
We
or
don't
you're not
spend it.
It's the
contributing.
most conservative way to
Yeah.
Yes.
look at it. That it's a entry,
Paper entry? just
paper
quickly?
entry. I think it's a paper entry, or is it?
Well, so what
actually-
happens?
So it doesn't figure into our,
you have,
when we're putting together our budget, that 1.5 million is not included in our budget numbers?
Oh, it is.
yeah, it is. But think about it this way, we don't spend it if those positions are, so that's automatically added to the beginning fund balance of the next year.
It's a good way to do it. What a lot of people do, let's say that you had 100 authorized positions, but you only filled 90 of them. And if you set your budget on 90 people, and then in the middle of the year you hire another 10, you don't have that money in the budget. So if you budget for it and don't fill it, then you didn't actually spend it. It's your money. You're not sending it anywhere. It's in your fund account. And then if you hire somebody, then you've got it in your budget to accommodate them.
But is the money physically moved into that slot?
Now that, well, it's in your budget, so your auditors have it in the budget.
Haley and,
We're taxing.
Okay, so, right, I understand that. So it moves from our reserve, our unassigned fund balance into assigned. We assign it here, but it's still drawing interest. We invest any of our cash position. So
There's some sort of a wash with it.
Yeah.
Interest earned.
It's either gonna be used up for its original purpose, or it's gonna stay in the reserve. So I don't know if Francis is on, or Haley, or Dustin might know, but.
I can, sorry, Judge, I can speak to it if you would like.
Yeah, so I guess my question is the money physically moved from one category to the other?
So kind of just also to touch base on what Commissioner Jones was saying, we do budget $7,433 per position within the general fund. And at the end of the year, regardless of if those positions are filled, we do max out that expense and move that total budget to the health fund. So if a position isn't filled, we are still moving that money. And then we will make a transfer for those total funds to be in the health fund.
Okay. Well, I mean, it is the most conservative way to do it.
And that's what we've done.
Pardon me?
I'm sorry. That's what we've done historically is we even expense for those unfilled positions.
Okay.
I mean, we could certainly look at.
I think it ought, no, I think it ought to stay like it is, because one thing that we don't want to do, and we do it in all of our budgeting process, is to be able, in our major philosophy on how much reserves we'll have as running the county government, is we came up with 33%. And so that prevents us from having a knee-jerk reaction to an expense that hits us. So we have a smooth for the taxpayer. We're not going up and down and up. It allows us to have that shock absorber through there, and that's what. So, in a smaller scale, that's exactly what this does. So, I hate to have those times where we have a need, where we have high claims, and we got to scramble and get money into there.
Yeah, not having to add to this from the general fund is the last thing that we.
I think a reasonable taxpayer that has a basic understanding of how you ought to save and those kind of things would say that this is the right approach to take. Do y'all think that?
Oh, absolutely, and I think also if we left it in the general fund and we hire half these people, there's gonna be so many transfers coming in, and then you have the opportunity for mistakes to be made because you're moving money, and I think it's just wise.
It's just where it's held.
It's
just a holding spot.
Yeah.
We're holding money, even if it stays in the unassigned fund balance, we're just holding it into that. We invest it, relative to when we think we'll need it in regards to terms. And
just cleaner this way too.
If we fill half those positions in a year, which I don't know historically how many we fill. If we have 100 in a year's time and we fill 50% of them, we fill 50 positions. At $8,000, that's $400,000, and we're sitting on 1.5 million.
So if we took it out of there and put it back into the unassigned fund balance, it's no different. It's still ours. Or I would say it's the taxpayer's money. The reserve belongs to the taxpayer, whether it's in this account or this account. And it's our job, the investment committee piece of it, to invest it wisely to get the highest return, but don't put it at risk because it's gonna be assigned to a particular purpose.
Yeah. If you were an insurance company doing business in Texas, you'd be regulated and you'd be required to hold reserves.
Right.
And so in essence, you're self-insured, so you're not regulated, but you're acting like the insurance company.
Yeah.
And you should hold a reserve.
Okay.
This is how a self-funded plan should work.
Do you agree? You're the professional consultant. Is that right?
Yes, yes. Yeah, you should have the fund balance. And so, I was gonna say, the county of El Paso,
You know, you can't,
years ago.
we should not be taking on risk.
Yeah, the county of El Paso.
This is just like our
decided to-
investment, this is just like what you spoke about, our investment policy. Should be the least risk possible.
Yeah, so the county of El Paso used to hold 90-day reserve, and then a few budget cycles back, they're like, well, what if we just make it 60?
Yeah.
And then they got to 60, and then the dam broke, and there were lots of losses, and they went to 0. So they've changed their policy to say, now, we're always going to target 90 days. But there's also, you know, the efficient allocation of resources. Like you say, if it's better served in your general fund, in your investment strategy and making some money, as opposed to just sitting in a savings
There should be
account
no
or something.
illusion that this is going to, this trend continues. If you look at the trends, it's up and down all the time. And there's been good and there's been bad, and there will be, continue to be good and bad. So.
Yeah, so the last concept that we're considering too is a large part of the spike in the prescription drug costs has been due to the increased prevalence of the GLP-1 drugs such as Ozempic, Mounjaro, Zepbound, Wegovy. Those are expensive drugs. They're about $13,000 a year per person. And every plan sponsor has a lot of people that are taking those. And we're really just 2 years into collecting good clinical data, but the early information from the clinical data is that they're doing a great job for type 2 diabetics and helping them get control of their blood glucose and their A1Cs. They're coming off of, they're losing weight, of course, which is why it's so popular. And as they lose weight, there's less reliance on drugs for hypertension, hyperlipidemia. Heard people are having fewer musculoskeletal complications because of the losing weight. And it's been a high-profile thing in 2 years of clinical data. While it's good, it's not, you know, enough for everyone feeling comfortable to hang their hat on. But as the industry has reacted to those drugs and come up with prior authorizations and controls to make sure that you really, you know, you're diabetic, that's why you need the drug. It's not that I'm overweight and I just want to lose weight. But at some point, the people that are taking these drugs, they're going to improve their health to the point where they're not going to pass the criteria to qualify for the drug anymore. And so what's changing, and I'm surprised myself sometimes, because I don't change that often, but I've pretty much been on the side of the table of health plans where most health plans don't offer coverage for weight loss treatment. And that's just because the mentality's been that, well, that's something that you can control and it's not my job to provide a benefit to help you lose weight. But now that we're seeing the results coming in for the GLP-1 drugs, and it's having great results too in lowering the risk of stroke and other cardiac events, that there's a mindset change taking place across the country where a lot of employers are saying, I just spent 2 years paying $13,000 a year for you, Randy, so you could get healthy, and now you can't take the drug anymore, and what am I going to do? I'm go back to being diabetic or something? So what they're starting to do is come up with strategies to, I would call it the exit ramp from the GLP-1 drug. So I'm an at-risk type 2 diabetic. I'm taking the GLP-1 drug, and you have to keep taking it for it to have the effect for you, because if you stop taking it, you kind of go back to the norm if you don't do a lot of extra work. But if I get to that point, the employers are saying, I've just dumped a whole lot of money on you, Randy, and I don't want it, because you got healthier, I don't want you to go back to the way you were. So what if we devise an exit ramp to say, just because you can't qualify for Ozempic anymore, doesn't mean that you can't take Wegovy, which is just for the weight loss. And so it's a strategy to continue to offer benefits to people that are in that risk category. And because that category of weight loss is not a protective benefit under the Affordable Care Act, it does not have to be treated like any other illness, which means it's covered without limitation. So one of the things that we're examining at HUB, as well as the entire industry too, is to come up with a plan, and it doesn't have to be an unlimited benefit. So the plan could say, we're going to go ahead and add coverage for weight loss, and that might cost the county, in the early projections, maybe $200,000 of increased drug expense by adding coverage for weight loss. But you're going to be improving the health of your population, and you're going to keep the people that have crossed that bridge on their A1C, et cetera, in a healthy category. And I think it would be a great investment for the county to give consideration to that. And you don't have to cover it unlimited. You could say, you know, now that you're off this, we're going to offer you coverage for Wegovy, but only up to X dollars per year or X number of years.
Even coverage for dietitian and.
Yes, and also have therapies and dietitian, weight loss classes, so that it's not always just a solution of take a drug.
Would an exit ramp also be access to free gym membership?
Yes. We already have that.
Yeah, you already have a lot.
I know we do.
So let's just say the why. Well, so I did a tour of the Y yesterday, and I'm afraid what I'd do is go there, and y'all would think I was exercising when I would actually be in the cooking class that they had. So that's
It could be.
what you have to be careful about. Well, we can talk about this for.
Yeah, so those are just some things that are coming, but as you enter your budget process right now, the road looks good.
Yeah, okay. Anything else?
Not for me.
Oh, I do, and I think this is important.
Okay.
When we first got into this 11 or 12, 13 years ago, there were these categories of plans, the silver or the gold, bronze, silver, and gold. Is that still around, and how do ours stack up? I mean, what would you?
It is. So the categories were platinum, gold, silver, and bronze.
Okay. Yeah.
Like a Christmas carol.
All the jewelry. Yeah.
So I always thought, and platinum was supposed to be, you know, the best coverage. I always thought they should have named it water, because water is probably more valuable than platinum.
Yeah, right.
Except here in Waco in the last month. But yes, they still have that, and your consumer-driven health plan would score easily. It would be like right on the cusp of gold versus platinum. I mean, so like in the top tier. And really, the government did that to make it easy for people that are buying coverage through the exchange. And
Yeah.
so when you go in the exchange, you can say, well, I want to look at a silver plan or a gold plan or whatever. And then that throws you into a category like that. And even your base plan would probably be right at the lower end of the gold, but not in the silver range. To get in the bronze range, and there's limits on how high your deductible and out-of-pocket can be under the Affordable Care Act. But basically, the worst case scenario is I have a benefit plan that's about a $9,000 deductible, and after that I have benefits. That would be like rock bottom of the bronze plan.
All right, any other questions, comments?
That's it. No.
All right, thank you very much, good
Sure,
report.
you're welcome.
Encouraging.
Thank you.
This one. And is there a motion to approve this report for recording purposes?
So moved.
Second.
Have a motion, second, any other discussion? No other discussion, all in favor say aye.
Aye.
Opposed? Pass. Thank you.
You're welcome.
Safe trip back. All right, Dustin, you had an item you wanted to go to.
Yes, sir. Is Judge Bain in the courtroom, Judge?
Do not see him, we can get him.
All right, he was gonna come over when he's available, so when he comes in, we can jump to that item if that's okay.
Okay, okay, Zane's going to look. All right, well, let's pick up something else.
All right, we'll go to item F2. This is authorization of quote from Solid IT Networks for Fortinet firewall maintenance renewals. I'd like to call in John Carter.
Good morning.
Morning.
So what this is the quote for our regular yearly maintenance, the total $37,480.36. We originally had budgeted $24,000. This came in a little bit above, and we're asking for a $19,736.78 from contingencies to our repair and maintenance budget to cover this. We did get a $16,380 offset from our vendor, Astound. And this does cover us through November of 2025. So it's actually 16 months of coverage. This has been reviewed and is recommended for approval.
All right, are there any questions?
Motion to approve.
Second.
Have a motion, second, any other discussion? No other discussion, all in favor say aye.
Aye.
Aye. Oppose, pass. All right, Dustin.
All right, we could
Judge is here.
go to, all right, if we can go to item M9, this is approve and ratify joint order appointing associate criminal judge, jail magistrate entered by the judges exercising criminal jurisdictions, including appointments, assignments, and duties, and authorize the associate criminal judge magistrate to serve all the courts of McLennan County hearing criminal matters. So as court members before, we had set up these three part-time associate jail magistrate positions. Guy Cox has retired, and so the judges hearing criminal matters have met and have appointed Dick McCall as an associate criminal judge, jail magistrate. So we just need to approve and ratify that joint order. And I know Judge Bain is there in case there's any questions or if he'd like to make any comment.
I'd like, yes, Judge Bain, you got the floor and make your introduction and.
Okay. Yes, this is Richard McCall, long-time lawyer here in McLennan County. He's had a lot of experience in family law, which of course involves a lot of family violence and protective orders, which we do a lot of. He also has a lot of experience in criminal, representing the criminal section for quite a while now. He retired about 9 months ago, so there's no conflicts on practicing in any of the courts. And so it's difficult finding a lawyer that doesn't have any kind of a criminal practice or belongs to a firm that has any kind of a criminal practice. So Mr. McCall, I was surprised he's only been out for 9 months that he agreed to do this, but he got permission from his wife, so we're good to go.
That's the key right there.
You get a short honey-do list.
Yeah, yeah. Well, why don't you tell the court a little bit more about yourself?
Well, lifelong Waco resident, practiced 52 years, almost 52 years before I retired. So I would be looking forward to getting kind of, back in the group that I've been associated with so long. And I apologize for the casual attire. I was out running errands, like Jim was saying, on the honey-do list, but I've kept abreast of the law and been studying more on emergency protective orders and interlock devices and things of that nature, and I would appreciate the appointment.
Okay, well, if I'd have known he was coming forward, I would have written a letter of recommendation. But known him a long time, great guy, besides being a very skilled attorney. And so any questions for him? I'd make a motion that, yeah, I'd make a motion that we grant that request Judge Bain brings.
Second. Yeah.
Motion made, second, any other discussion? No other discussion, all in favor say aye.
Aye.
Oppose, pass. Welcome.
Glad to very much.
Glad to have you.
Hope that wasn't too painful.
No, that's.
Now all the work begins,
Yeah.
fingerprinting and doing all that kind of
Yeah,
stuff.
yeah.
Take my 8-hour course and.
Yeah, we appreciate
For
it.
CLE.
We can help you, let us know.
Thank you, Dave.
All right, thank you.
Appreciate it.
Thank y'all.
Thank you,
All right.
Judge.
Okay, Dustin?
All right, we can go to item F3, authorization of proposal with True Colors International for Information Technology Cultural Enhancement Training Program. John?
This item is a proposal for a True Colors course for the IT department. It's $6,715 for up to 30 participants, just to help us communicate better. This has been reviewed by the legal team and is recommended for approval.
Okay.
It's in the budget.
Yes, sir.
Yes, it's within the budget.
Yes, sir.
Great.
All right, what's the pleasure of the court?
Motion to approve. Second.
I have a motion, second, any other discussion? No other discussion, all in favor say aye. 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 Oppose, pass.
F4, authorization of recommendation for bid 24-007, McLennan County Holy Road at North Cotton Creek Low Water Crossings. Ken?
Yes, I'm sorry. I think I was fixing to pick up the wrong thing. We received a number of bids on this. We received a bid from C-A Native Contractors in the amount of $1,154,871.99. We received a bid from WR Utilities, $816,315.50. A bid from Bear Creek Construction, $639,562. JH Contracting, $864,240. Holy Contractors, amount of $727,511.53. Meckel Contracting, $757,582.19. Barnett Contracting, $704,284. And Kasperian, $716,729.10. We did make a note that on Holy Contractors that they had a little bit of money difference in their bid. They did a unit price of $20,000 and then a bid price of $2,000, but it did make a difference in our recommendation. I just wanted to point that out.
Okay, so
We recommend that McLennan County grant the award for the McLennan County Holy Road in North Cotton Creek Low Water Crossing to Bear Creek. All right, construction for the sum of $639,562.
All right, any questions or comments?
Is this, Zane, did you look over this bid?
Yes, it's recommended for
All right, motion to approve.
Second.
All right, a motion second, any other discussion? No other discussion, all in favor say aye.
Aye.
Aye. Oppose, pass. Thank you.
All right, F5 is regarding the scope of services with Mundo and Associates for McLennan County Parks Recreation Open Space Master Plan, authorization invoice number 7. Progress is now 100% complete, as the court is aware, and this invoice totals $2,492.50, and it is recommended for approval.
All right, any questions or comments? What's the pleasure of the court?
Motion to approve.
Second.
A motion second, any other discussion? No other discussion, all in favor say aye. Aye. Oppose, pass.
Item G, contracts interlocal agreements. G1 is authorization of letter of agreement with McLennan Community College for Heart Saver CPR AED first aid training. Anna?
Yes. Hello, everyone again. I have an agreement here with McLennan Community College to have them help us conduct the Heart Saver CPR AED first aid training. This was conducted 2 years ago in 2022. We offered that to all county departments. We had 167 county employees certified through this training program. That certification that was received then has a 2-year lapse or expiration. And so we're coming up on that expiration, and we want to offer the opportunity to train again to be sure those certifications don't lapse. And we left a few more slots for some additional training as well. The cost is up to $10,000. That's if we get all 200 slots filled. And this would be coming out of the HR budget.
Okay, any questions?
Did you look at any alternative providers? Would anybody else offer the service?
We really got a lot of great feedback from the McLennan Community College training the first round, and so we wanted to continue with McLennan Community College and their training.
Any other questions? What's the pleasure of the court?
Motion to approve the letter of agreement with MCC.
Second.
All right, I have a motion second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass.
Thank you.
Thank you.
G2 is authorization of agreement proposal with CoFile Technologies for preserving, imaging, and indexing district clerks' historical case files. This proposal totals $50,015.76. It is on a state contract. It is to preserve, image, and index case files going back to the late 1800s. It'll do a number of those cases, and this is kind of working from one end. And John's also working with the iDocket on our Image Tech, I'm sorry, on some of the more recent files. But it's been reviewed and is recommended for approval.
Okay, any questions or comments? If not, is there a motion to approve the agreement proposal with CoFile?
So moved.
Second.
Have a motion second. Any other discussion? No other discussion. All in favor say aye. Aye. Opposed? Pass.
G3 regarding the service as a software as a service agreement with Tyler Technologies, authorization of amendment for implementation of enterprise jury software and services. John?
Yeah, so this is, this would be an amendment to our original contract. And the numbers are actually off a bit. The numbers you're seeing of $62,160 for one-time costs and $57,277 for the ongoing yearly maintenance, for a total of $119,437 are slightly off. We got a new quote for that, and the costs have changed. The $57,277 is still correct for the ongoing, but we lowered the cost for the one-time installation to $58,090 for a total of $115,367 for the first year. And this would be for the jury management product. We've had several discussions with the vendor, as well as the judges, district and county, and our district clerk. And all of us have agreed this is the way we need to go with this, or this is the proposal we have for the court. It would require a budget amendment from contingencies at this point. And with that, I would take any questions.
Okay, I know all the judges have looked at it and asked a lot of questions, and now recommending this. It should be a lot more convenience application to the people that are called for jury duty. But if you need more information, we can get that too. Any questions or comments?
I don't need any more information. I certainly respect the judge's choice. And my only question, John, would be, because it requires a budget amendment, is there a reason why now and not during the new budget year? The same question I always ask.
Yes, we wanted to, so we have two issues with waiting till the budget. One is they believe they're about to be awarded a federal contract for federal juries and judges and courts. And if they get that contract, they will not have the bandwidth to do this project for us. And number two, we wanted to have the jury product in so that when we went live with our other Tyler products, that we'd already have everything in place. Plus, it also helps us get it in place for moving to the new downtown jail, remodeled downtown jail. And they believe they can get this project done in 6 months.
So this is going to require less, at some point, this will cut down on the amount of people that come down here. Is that my understanding?
Right, and they could, well, John, you can speak to it, but some of the features of it, but basically.
Correct. It is an electronic jury management system. So the potential juror would first of all get a questionnaire and email, and they would go to a website and they would fill it out. So we could obviously pre-qualify folks before they ever had to go stand in line, or disqualify folks before they stood in line. And there's also a reschedule feature to this. So if, for instance, they have some big life event where normally they would either call the district clerk's office and have to deal with them, or come down in person, they could do all that online and they could just put in the times that they're available, and it would be much less hassle for every juror. It would cut down on all the people that don't show up and all that sort of thing, and the overhead that requires from the district clerk's office and the expense to the taxpayer thereof. And be better for the judges because they would get their juries all put together more ahead of time. And then also, if, for instance, there's or what they call it, but if the case is either dismissed or settled beforehand, like on a Saturday or a Friday or something like that, then the juror doesn't have to show up on Monday. They would get notified via text or electronically.
Sure.
It also has the ability, if the judges so choose, to have the jurors show up directly to the court location rather than having to go to the visiting court.
Bringing everybody to.
Yeah.
It sounds like it's as much a benefit to our taxpayers who are chosen as, or potential jurors as anything else, and I certainly support that, yeah.
And if I could, one more thing, we are looking at the allowability of ARPA funds for this. We think it's a fit. Forbes is looking at it too.
Great.
For the reasons it's an improvement to judicial software that limits people in a congregate setting. So we think this is a fit, and so we're looking at it, and I'll touch on ARPA a little bit later as well.
Okay. And John, you did say we'd have this in place before the new jail conversion takes place?
Yes. In fact, they would expect if we went forward soon to be done by the January of 2025.
That was just that was tongue in cheek. I'm sorry, John.
All right, is there, after listening to the presentation, there's no other questions. Is there a motion to approve the amendment that would be under contract total of $115,367?
So move.
Second.
Does that add up right? Did I have that right?
115,367
Yeah,
is what
yeah,
they told us. Yes,
yeah,
sir.
okay. All right, and we have a motion second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass.
G4 is regarding the second professional consulting contract addendum with Lockwood, Andrews and Newnham Incorporated, authorization of professional service invoice. This invoice totals $11,000, and it's for those professional services related to water planning from January through April 2024, and it is recommended for approval.
All right, and I've worked with them on this, and I would also recommend it. In fact, I'll make a motion, we approve this.
Second.
Have a motion second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass.
G5 is regarding the professional services agreement and related geotechnical pavement proposal with Langerman Engineering, ratification of additional services proposal for the Judicial Center. Zane?
Yes, sir. So the geotechnical company, Langerman Engineering, could not drill into the ground without getting off the pavement. And so it's been so wet, they're needing to use their ATV to get off the pavement and to do the coring in the ground. And so that's an additional expense of $1,500. The judge has already signed this and approved it. So this item is actually ratification of his signing the document for an additional $1,500. It's recommended to be ratified.
All right,
Motion to approve. Second.
motion second. Any discussion?
Behind us or across the street?
It's actually over here behind the alley and the alleyway. There's so many utilities underneath the ground.
Yeah.
They need to
Move it.
they need to core into the ground, but there's a lot of utilities underneath the ground, and so they need to get the coring rig off of the pavement onto the grass.
Oh, okay.
And the big heavy truck that has the coring equipment won't do well on the grass, so they need to use an ATV coring rig system to get it onto the grass.
Yeah. Okay. Any other questions? All right, we have motion second. All in favor say aye.
Aye.
Opposed? Pass.
All right, G6 is authorization of agreements for services with Millard Real Estate Advisors. G6A is regarding real estate consulting right-of-way acquisition services along Bullhead Creek Road. And G6B is regarding real estate consulting services for the sale of 0.379 acres of land situated within J.M. Stevens Survey, City of Waco. Zane?
Yes, sir. So the Bullhead Creek Road as you know, we're relocating the road further away from Bullhide Creek due to erosion issues. And so we're needing to purchase a bit of right-of-way there to allow the relocation of the road further away from the creek. And then on the G6B, this was a request from the private owner that lives next to Valley Mills Road. He was wanting to purchase 0.379 acres behind his property that butts up against Valley Mills Road, between Valley Mills Road and his property. The land does not cross over any of his adjacent property owners. It's basically taking his property line, if you will, straight back to Valley Mills Road. There's over 5 acres of land there that's right away. I believe it was used by TxDOT and or the contractor back when they expanded Valley Mills Road from a 2-lane to a 6 or 8 lane road.
What it is,
So it's pretty large, and so they had to have a place to stage their construction, and so they had 5 acres of right of way there that they used. So that was the county owns that right of way. He's looking to improve his property, add a swimming pool, and grow his family, and so he needs a little bit more property. He's looking to purchase 0.379 acres. We've had legal look at it. TxDOT says they don't own it. They don't care if we sell it. It's inside the city limits of Waco. Waco's denied they don't own it. They don't have a problem with us selling it. So this contract would be with Millard Real Estate Advisors to help negotiate the sale of 0.379 acres to the property owner, which is Peter and Summer Ellis. And so those 2 right-of-way acquisitions, one for Bullhide Creek Road, one for right-of-way off of Valley Mills Road, those are recommended for approval.
We're talking about Valley Mills Drive, right?
Valley Mills Drive.
We're on Valley Mills.
Yeah, 5 acres on Valley Mills Drive. Man, that would be worth that money.
There's no address cited in any of the contract or anything like this. I mean, I'm not concerned. I know Peter. And,
Just interesting.
Yeah, I'd just like to know where it was.
I can get that later to you. I don't have it in
Just
front of me.
if you could shoot that at some point. I mean, that's.
I believe in the packet there should have been a map. But
Well, there's on the map. It just is. There's no reference to any. It just says Valley Mills Drive, and then it gives. I see the parcel, and I see Peter's parcel and his neighbors, and.
Yeah, there's some cross streets nearby. And I didn't.
There's no like big map, on those plat maps, how they'll do a big map.
I'll get that to you.
Just shoot it to me. That's all.
This pertains to the fee we pay Millard, right?
That's correct. This is for the right-of-way consulting fee.
Okay.
So motion to approve G6A and B.
How do we determine what who determines what the value of that is?
That's why we're hiring a
What they'll do.
real estate professional to help determine that cost.
Okay.
I second his.
I have a motion second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed, pass.
All right, G7 is authorization of agreement for engineering services with BGE for Patton Branch Road at Aquila Creek Low Water Crossing culvert replacement. Zane?
Yes, sir. So as y'all know, there's some large culverts that were lost during the big heavy rain events during May. And I mean, these culverts were like 10-foot diameter, 80 feet long, something like that. And so this issue is for an engineering, an agreement for engineering services with BGE to design the replacement of those low water crossings. It's recommended for approval.
Motion to approve.
Second.
Have a motion second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed, pass.
Thank you.
Zane, if you want to stay, I'll drop down to H real quick.
Sounds good.
Under H, capital improvement construction projects, H1 is regarding Chapel Road improvements, agreement with Casparian Underground, doing business as H&B Contractors, authorization application for payment number 4.
Correct. So this is payment number 4 for the construction on Chapel Road improvements. It's for $519,210.34, and it's been reviewed and is recommended for approval.
All right, any questions about that? Sound like the project's going good?
Motion to approve.
All right, a motion.
Second.
And a second, any other discussion? No other discussion, all in favor say aye. Aye. Opposed, pass.
H2 regarding construction of Panther Branch Road Bridge at Rock Springs Creek, agreement with Knife River Corporation, authorization of applications for payment number 6. Zane?
Yes, sir. So this is for the bridge being built on Panther Branch Road. This payment number 6 invoice is for $23,364. The invoice has been reviewed and is recommended for approval.
All right. It's a $290,000 plus project. Any questions? All right, what's the pleasure?
Motion to approve.
Second.
Motion second. Any other discussion? No other discussion. All in favor say aye. Aye. Opposed, pass.
Thank you.
Thank you.
All right, moving back up to item G8, authorization of contract for services with Greater Waco Collective Impact Initiative doing business as Prosper Waco. If we could defer this week.
I'll make a motion, we defer.
Second.
And we have a second. Any other discussion? No other discussion. All in favor say aye. Aye. Opposed, pass.
G9 is authorization of professional services agreement with Waco Foundation. This is for the professional study of McLennan County Healthcare System Partnership for Accessible Care and Economic Stability, the PACES project. I know this was presented to y'all at the city county meeting that Waco Foundation would be the fiscal agent and leading this effort. This is ARPA eligible. We are proposing to take it from the lost revenue portion. It makes things easier with the federal procurement standards, since the lost revenue piece can go for the provision of any governmental services. So this is just an agreement with Waco Foundation to be the fiscal agent and to lead that study on the PACES program.
Okay. Any questions? I'll make a motion, we approve.
Second.
Motion made second. Any other discussion? No other discussion. All in favor say aye. Aye. Opposed, pass.
And if it's all right, if we could drop down to 2 items for Heather on item M3 regarding the local provider participation fund.
All right.
M3A is a ratification of intergovernmental transfers of funds under the CHIRP program. And then M3B is authorization of an IGT under the RAPS program. So Heather?
Yes, thank you, Dustin. And as he said, the first is a ratification. We had a late notification for an IGT request, and that was in the amount of $9,137,106.14. And that was for CHIRP Program Year 4 Advanced, and that was completed yesterday, June 17th.
Okay. That's driven by a formula. I'll make a motion, we approve it.
Second.
I have a motion second. Any other discussion? No other discussion. All in favor say aye. Aye. Opposed? Pass.
Okay. And then the next one, do you want me to do that one as well now, Judge?
Yeah, please.
Okay, and this one is an IGT request, and we're requesting to transfer up to the balance in the LPPF, which is currently $3,861,671.22. And this is for program year 4 RAPS. And it has a due date of June 20th with the settlement date of June 21st.
Okay. All right. Any questions or comments on that?
Motion to approve.
Second.
Motion second. Any other discussion? No discussion. All in favor say aye. Aye. Opposed? Pass.
Thank you.
Thank you.
Thank you, Heather.
All right, we can move back up to item I, budget amendments. I1 is regarding the FY24 budget. Haley?
Yes, sir. And then I can cover them all if you would like, and we can approve at the end, all of them at the end.
Okay.
Item I1A, this budget amendment is in the general fund for the 19th District Court to increase professional development to cover recent training costs and costs for the remainder of the fiscal year. Item I1B, this is a budget amendment in the general fund for capital outlay to replace a food warmer in the jail kitchen. This department will be moving from the Highway 6 furniture and equipment to cover this cost. Item I1C, this is a budget amendment in the general fund for the county judge's office to increase supplies from within their department for costs for the remainder of the year. Item I1D, this is a budget amendment for the district clerk to increase conservation of records and other services and charges across multiple special revenue funds. This being Fund 125, the Court Record Preservation Fund, Fund 144, the District Court Records Technology Fund, and Fund 120, the County Records Management and Preservation Fund. These are related to two items that have been approved for the district clerk, one being the image tech proposal that was approved on May the 7th, and then also the item today, item G2 that was approved. Item I1E, this is a budget amendment in the Economic Development Department to cover the cost of the total impact dashboard annual licensing fee paid for by the Greater Waco Chamber of Commerce. And this will be coming from contingencies. Item I1F, this budget amendment is in the 2021 bond funds in relation to the downtown jail project. This is to increase the budget for the amendment to the professional services agreement with Brinkley Sargent that was approved on April 15th. Item I1G, this budget amendment is in the general fund for JP3 to increase professional development from within the department to cover training costs. Item I1H, this budget amendment is in the general fund to increase repair and maintenance of building from contingencies to cover the cost of replacing windows in the annex that were damaged during some demolition of the old downtown jail. And you'll see that invoice attached. And this request is also to increase from within the department to cover costs for the remainder of the fiscal year in the supplies line. Item I1I, this budget amendment is in the general fund to increase Road and Bridge 3 from within the department to cover supplies for the remainder of the year. Item I1J, this budget amendment is in the general fund for Road and Bridge 1 to increase supplies from contingencies in that department to cover costs for the remainder of the year. Item I1K, this budget amendment is in the general fund to increase capital outlay in Road and Bridge Precinct 4 from contingencies within that department to purchase a Freightliner truck. And that is the last of the 2024
Okay.
budget amendment.
Thank you. Any questions on any of those?
Just on the damage to the windows, was that caused by the people doing the demolition? Were they responsible for that? Is TJ on?
Commissioner, no, it wasn't necessarily by the demolition that was going on. So if you remember way back, those windows were actually covered with metal panes. So when those metal panes were removed, a lot of those windows were cracked already. So we went through and temporaried in, plastic up, boarded up with plywood in hopes that we'd have started the other project by now. And of course, that's kind of dragging on, so we hadn't got there yet. So we need to do something that's a little more permanent to keep the water and the pigeons from coming inside the building.
Correct. Okay. All right. Thank you.
How quick do you think you'll get that fixed?
As soon as we release the budget amendment, we'll release them with a PO. So it'll be a matter of probably 2 to 3 weeks, and they're going to utilize our lift to get up there. So everything has to be done from the outside. So
Right. Okay.
it'll take a little bit of time to get it done, but shouldn't be too long.
All right, thank you. All right, any other questions about the items? All right, is there a motion to approve I1A through I1K?
So moved. Second.
Have a motion second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Aye. Opposed? Pass.
I2 is regarding the FY25 budget. Haley, did you have anything today?
Yes, just you should have received an email yesterday with a link to access some initial documents that we have out on a OneDrive file. You'll see the general fund worksheet, special revenue fund worksheets, and personnel requests and related documentation, and those would be directly from the departments. And we will just keep continuing to update these spreadsheets and add additional information as it becomes available. So if you have any issues accessing those documents or any questions, just let us know.
So we just keep using that same link and you'll update it as we go along.
Yes, that would work perfectly.
Yeah.
And the budget workshop dates are the same that we've already talked about, correct? No changes?
Yes, sir. Not as of today.
Not as of today.
I mean, this is what we all decided. Now, if there's any changes, please let us know.
Want to make sure they hadn't changed.
Yeah, okay. All right. Let's see, is there any action needed on that?
No, sir.
Okay, thank you. All right.
All right. So we'll move on to item K, grant proposals. K1 is our ARPA discussion. Are y'all good if I just kind of share our spending plan?
Yeah.
Worksheet and step through it for just a second?
Go right ahead.
All right. So just as a general reminder, just kind of step through how we've approached ARPA. Total was 49.8 million. That lost revenue portion of it was the $10 million. As you can see, we've already plugged the PACES, 50,000 in here. That still leaves us a little over $9 million for the downtown jail project. And Haley has helped me keep this updated. And so numbers may be a little bit off just due to rounding, but she has a budget amendment on in a little bit as well. So that left 39.8 million after that 10 million lost revenue fund was pulled out. Of that, 25.5 million essentially has gone to what we've called non-county projects. Those are listed on your screen, including 10 million of the water infrastructure. Inside the water bucket, we still have right at 105,000 that has not been allocated yet. And we do still have the Old Springfield Road project that we need to discuss. Stepping over into the county projects, that left about 14.3 million for those projects. That had identified 5 million for HVAC upgrades, including the air purification. We have the Active Pure and then also the Active Pure maintenance as part of this. Working with TJ, and he's been talking to the mechanical engineer on the HVAC project. We're estimating that to come in at about $4.5 million. Should be under contract with it in just a couple of months. So it's progressing well. That's going to leave 104,751 unallocated out of that 5 million. The next bucket is the 5 million for the HVAC and the different bid packages at the downtown jail that we'll be addressing as we move forward. We'd put 2.5 million aside for low water crossings and culverts. We had previously approved a couple of those projects. We had Holy Road today at that 639,000. And talking to Zane, there's two other ones. I know Patton Branch was approved today, or the engineering was, and Fern Valley. So these cost estimates have been plugged in. That would leave us with about 255,000 in that low water crossing culverts items that's still unallocated. Stepping on down, these are our costs from early on in COVID with the base rental, COVID testing, cleaning supplies, those things. One thing that Haley has helped with, and is now a requirement from Treasury, we need to project the cost of our consultants through 2026. So these numbers have changed, and you will see this is what we are anticipating to spend with the consultants all in through 2026. These numbers will go up and down. We're trying to get more detail from LAN and also working with Mike as well. So you'll see just overall, we have $240,000 that's still unallocated inside ARPA. And then when you step over here and look at that unallocated plus the remaining dollars left in the water projects, the HVAC and low water crossing items, that leaves about 705,000 that has been unallocated. Walker Partners has given us their estimate on Old Springfield Road at 323,000. So that leaves us with about 381,000 that we need to obligate by the end of this year. So just something for the court to be thinking of. We've talked about those software items that could potentially be eligible. We also have requests from United Way, from Salvation Army. We have one from the YMCA that we'll be scanning in and sending out to commissioners. So just wanted to get everything on your radar and let you know where we sit right now. Of course, those numbers can go up and down depending on where the culverts come in and where the HVAC bid comes in, but just wanted to give you a quick update.
All right, thank you. Any questions?
All right. K1A is approval of blanket orders for beneficiary and subrecipient agreements. We just need to defer this again.
All right, I'll make a motion, we defer.
Second.
Motion made and second. Any other discussion? No other discussion. All in favor say aye. Aye. Opposed? Pass.
A1B is authorization of American Rescue Plan budget adjustment. Haley?
Yes, this is just the quarterly budget amendment for the ARPA funds. There's only one item that was approved this quarter. The $33,000 maintenance agreement for the air purification with Active Pure. On the second page, under the administrative category, you will see the estimates on top of what we are actually in contract with. So that would be the amount that we would need to obligate more officially by the end of December. But like Dustin said, these numbers will probably fluctuate, but for the purposes of the reporting in the next month, we need to go ahead and get this estimate reported.
All right, any questions? What's the pleasure of the court?
Motion to approve.
Second.
Have a motion, second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass.
K1C is authorization of legal services invoices from Haley and Olson for ARPA matters for May 2024, and it totals $2,160, has been reviewed and recommended for approval.
All right,
Motion to approve.
Second.
have a motion, second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass.
K1D is regarding the professional consulting contract with LAN. This authorization of professional service invoice 20A. This totals $24,959.70, and it's for their expenses related to project identification and engineering monitoring under ARPA through May the 10th, 2024. It is recommended for approval.
All right, any questions?
Motion to approve.
Second.
Have a motion, second. Any other discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass.
K2 is regarding the State Criminal Alien Assistance Program, SCAP, authorization of FY24 grant application submission. This is the annual grant we apply for that provides federal payments to localities that incur correctional officer salary costs for incarceration of certain undocumented criminal aliens. We just need a motion to approve the submission of this grant application.
In this, in the application, does it give our total, what the total cost is?
So there is a calculation that JBI, that Justice Benefits Group, helps with us. So once we get that worksheet back, we will share it with y'all.
Great.
I have a motion.
And second.
Okay.
All right, we have a motion, second. Any other questions, comments? If not, all in favor say aye.
Aye.
Opposed? Pass.
All right, and Haley, I'll just read the next 4 items in. K3 is regarding the Texas Department of Family and Protective Services Title IV grant. K3 is the Child Welfare Services claims. K3A is for quarter ending December 31st, 2023. K3B is the quarter ending March 31st, 2024. K4 is regarding Title IV grant for legal assistance claims. K4A is the quarter ending December 31st, 2023, and K4B is March 31st, 2024.
All right, any questions? If not, all those previously mentioned, they.
Motion to approve.
Second.
Thank you. Motion, second. Any other discussion? No other discussion? All in favor say aye.
Aye.
Opposed? Pass.
Under item L, Department Office Specific Request, L1 Mental Health Court Services, authorization of Zoom account license. Ken?
Yes, we had a request to change their subscription to a Zoom Pro account, and the prorated amount is for $76.46. It's an annual contract that normally would be $199.90. So again, we're just changing it and need this extra money to do that.
Okay.
Zoom more than what the free Zooms are, so they need their own, my understanding, their own contract, which is really an efficient way to do it, though, the Zooms are, so.
Right.
My motion would be to approve.
Second.
All right, I have a motion, second. Any discussion? No other discussion. All in favor say aye.
Aye.
Opposed? Pass.
Right, under item M1, selection designation of public members of the Salary Grievance Committee regarding the FY25 budget. Looks like we've had 5 people accept to date. And so, Mercedes, do we need to draw more names?
Yes, we'll need to draw some more names today.
Ready for a speed draw.
Okay.
All right.
Grab a handful.
I'm gonna draw 9 names.
Like we have 1,
9 today?
2, 3, 4, 5.
Let's start out with Kristen Taylor,
7.
Scott Dixon, Cindy Biles, Mary Burton, Troy Simonic, and Charles Wilson.
Got 3 more.
Then let's start with Tracy Lynn Bradshaw, K.D. Kribler, and the lucky winner is Dennis Howard. You got it?
Okay? Sound like some good prospects.
Victims.
And next court session, we will have an action item on should the court want to choose to go back to using the 9 members of the public as the Salary Grievance Committee.
Yes, and I will support that.
Sounds
All right,
good.
thank you.
All right, moving on to item M2. This is McLennan County Group Employee Health Insurance Committee authorizations regarding committee member selection.
So,
Judge or Commissioner
yeah,
Jones?
Yeah, let me speak to this. And I think that because of the final decisions are made at the Commissioners Court level, that I think that this committee really should be the Commissioners Court. And now, we got a good handle. We've learned a lot through the last several years. That does not mean we do not take input from all those people that have helped us out in the past. And so we've got our HR department is doing a really good job of being able to get a handle on the program, all the intricacies to it, and be able to explain that, but also be able to get feedback from the employees, and primarily through department heads and elected officials. So I would like to say, thanks to everyone that served on that. We're still gonna lean on you, but the actual decision, that committee would be the Commissioners Court. And I'll make a motion to that level.
Second.
And lastly, ask Commissioner Jones, he's done a great job in leadership in this to continue to help Commissioners Court kind of lead us through this. So, have a motion. Second, any other discussion?
I'll just say that, I keep in contact with Anna and Randy and their teams, and so seems to be working pretty good, and I look forward to moving forward with it.
Okay, thank you. All right. Good deal. Did we already vote?
Did we?
Yeah. No, we have a motion second.
And also too, if anyone has any questions, feel free to give me a call, Commissioner Smith, Anna.
Okay.
And then we definitely, we need input.
All right, we have a motion second. All in favor say aye.
Aye.
Opposed? Passed.
All right, moving down to item M5, authorization of Texas Association of Counties total loss settlement offer. This is on a 2017 Dodge Ram 1500. Looks like the net payment will be $19,348.
All right, any questions? Not, what's the pleasure of the court?
Motion to approve the offer.
Second. Have motion and a second. No other discussion. All in favor say aye.
Aye.
Opposed? Passed.
M10 is authorization of Texas Association of Counties Risk Management Pool 2024 Property Coverage Renewal and Related Invoice. So this invoice totals $519,887. That is an increase from last year, which was $415,913. Coverage period is July 1st, 2024 to July 1st, 2025.
When do we bid this out?
I mean,
We did about,
did you say when or when did we, Commissioner? I'm sorry.
So what, where is it on the bid calendar?
I think we looked at it, was it 2015 or 2016 last, sometime in that time frame, I believe.
This is a 25% increase in 1 year.
you're gonna
Well,
see it
and
though.
that's-
I'm just telling you, you're gonna see it everywhere.
Yeah, it's,
I'm not arguing, I'm just saying it
Yeah.
hurts.
Property coverage has gone up.
It's crazy.
Crazy.
yeah, and, on churches, unbelievable.
Yeah, I understand
It's,
churches taking a beating.
yeah, it's gone up.
Church Mutual has pulled out.
Yeah, a lot of them have pulled out of doing churches. And so churches were a place they thought they could get more business. They'd lower the bid, get a church deal, and then the congregation, marketing and sales.
And then the roof blows off
and
every
then-
few years.
Yeah, because it's a big old building and, God blesses everybody inside of it, but the building is material, and he doesn't really consider that. So, I think we're gonna see the same thing no matter where we go, but I'm open to what anybody wants to do.
I just wanted to clarify too, the reason I don't have it on the bid calendar, because it is TAC. And again, we don't have to tax us, so we don't have to bid it.
Yeah.
So I don't literally have it scheduled anywhere.
Yeah. So,
And what they do, the reason nobody really can compete with them is because their workers' comp rates are
But-
ridiculously low.
Right, and
So-
can we split that out, or?
I don't, well,
Or do we
I don't
want to?
think TAC will carry, I think we talked about that, and I don't think they want to carry a single line coverage.
Okay.
yeah.
They upped the deductible and up the invoice, the amount. Deductible went from 25 to 50,000,
And get ready when your homeowners renews.
Yeah.
already had.
Already has, yeah, it's already crazy.
What's the pleasure of the court?
Make a motion to approve.
I'll second. I have a motion and a second. Any other discussion? No other discussion, call for a vote.
Commissioner Smith,
Aye.
Jeff Felton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass.
All right, that should be all the action items. Judge, I think you wanted to mention something under the work session.
Yeah, one thing on the work session, I had, a meeting with, Captain Nixon, and he had met with, game wardens and, all about some issues at the trading house, safety issues, and, so, we're looking at, needing to, it won't take a lot of money, but we need to go through the process to put up some areas where our visitors to the park are swimming. We'll put a boat safety, some buoys up and protect that area. But also, we're looking into the legal aspect of being able to create an enforceable ordinance or something like that. And so Dustin is working on it, and we will go through that so we can issue citations either through the state or local agencies, which is county or game wardens or whatever, in that regard. So it's become a real safety. I've been reading it on social media all this last 2 weeks, and because we are the only lake open. And so we're trying to get this in place before July 4th, because there's a chance Waco could be open, but it's iffy. It may be only partially open, so.
Judge, just to add to that, since this is a meeting that's being recorded, I would like, just for public knowledge, to know that our game wardens are writing tickets now if you cross a physical barrier where they're at a flooded site or a road's closed and you go around it, the game wardens are writing tickets for that now.
Okay.
So just like for that to be public knowledge.
Right. All right, just wanted to make that report, and we will have something hopefully here in the next meeting, because we do need to move on it. And the sheriff's department's been offered a lot of help in this regard, being able to not only help build these things, but get them out into the water, placing them with sheriff's department's equipment to do that. So they're very interested, and they've stepped up their patrols out there, and they intend to do more through this summer. And so really appreciate all the effort that they put into it. Anything else to come before court? Mercedes, we have everything covered? All right, Dustin, anything else? All right. if
No,
not,
sir, we should be good.
All right, we stand adjourned.